Dave, can you still hear me? This is auto.
Yes. Your
Okay.
your audio seems to be a little more compressed though. Is your laptop open?
It's actually closed now. I think I
Okay.
might need to open it to make it sound better. I wonder.
Yeah, generally when you have the laptop open or if you're using an external mic, the sound quality is much better.
Okay, now it's open. Is it better?
It does sound better. Yes, thank you.
Okay, good. I'll just keep it open then. All right.
Great,
Thank you.
thanks.
Great. Thank you.
We are now live on the internet. Thank you.
Hello, Dr. Day. Can we do a mic check, please?
Good afternoon. How are you?
Good afternoon. Doing well. Thanks very much. How are you?
I'm doing well, thank you.
Good. Hi, Rhonda. Can we do a mic check, please?
Hi, yeah, can you hear me?
Yes, thank you.
Thank you.
You've got a little bit of an echo, Rhonda.
I'm going to try to put a microphone on.
Okay. Thank you.
Is this better?
It is a little better. It's almost distorted. I think you might be a little too close to the mic. If you could pull it away just a touch.
How about that?
Yeah, that's better. Thank you.
Thank you.
Hi, Paul. Can we do a mic check, please?
Sure. Good afternoon.
Good afternoon. Thank you.
Thank you.
Hi, Dr. Nguyen. Can we do a mic check, please?
Yes, good afternoon.
Thank you.
Thank you.
Hi, Jackie. Can we do a mic check, please?
I am here. Can you hear me?
Yes, we can. Thank you very much.
Thank you.
Hello, Moretta. Can we do a mic check with you, please?
Hi, good afternoon.
Good afternoon. Thank you very much. We can hear
You're
you.
welcome. Thank you.
Hi, Dr. Cody. Can we do a mic check, please?
Can you hear me okay?
Yes, thank you.
Great, thanks.
Hi, Yvonne. Can we do a mic check with you, please?
Good afternoon.
Good afternoon. Thank you.
Thank you.
Hi, Heather. Can we do a mic check, please? You're muted.
Thought we'd be done saying that by this year.
It's okay. It still happens. We can hear
Sorry.
you. Thanks. No problem. Hi, Laura. Can we do a mic check, please?
Hi, can you hear me?
Yes, thank you.
Great, thank you.
Jeff, can we do a mic check, please?
Yes, I'm here.
We can hear you, thanks. Curtis, can we do a mic check with you, please?
Good afternoon.
Good afternoon, thank you very much. Hello, Dr. Cho, can we do a mic check, please? You're muted, doctor. Try one more time.
Hi.
Hi, now we can hear you. Thank you.
Okay, thanks.
Good afternoon, Supervisor Simidian.
Good afternoon. I note that it is 2:01, so let me do a quick
Recording
mic
in
check.
progress.
We can hear you. Thanks very much. Colin will be your clerk this afternoon.
Thank you for that. All right,
Recording
ladies and gentlemen.
stopped. Recording in progress.
All right, ladies and gentlemen, forgive the back and forth on the tech side here. Good afternoon. I'm County Supervisor Joe Simidian. This is our Health and Hospital Committee meeting for the county. And we begin, as we always do, with calling the meeting to order and asking the clerk to call the roll to establish the presence of a quorum, even though there are only two of us, and it's pretty quick and easy to do. Go right ahead, clerk.
Will do. Vice Chairperson Lee.
Present.
Present, and Chairperson Simidian.
Here as well. Thank you very much. The presence of a quorum has been established. That takes us to item number 2. And item number 2 is that portion of our agenda set aside for comment by members of the public on non-agendized items, things that are not on the agenda, but where folks would like to comment. We allow up to 3 minutes. I see we have 4 folks with raised hands, so let's go ahead and call up. Wait a minute, we have a number of folks. If you would like to speak under public comment, I'm going to ask that you do that within the next 10 seconds, please. Just check yourself in because we need to know how much time we can allow pursuant to our rules. We have a number of folks. Thank you. Good to know. So what we're going to do is say we will allow up to 1 minute for everyone who would like to speak on public comment. And I'll ask the clerk to go ahead and call those folks in order of sign up. Thank you again, everyone. 1 minute, please.
The next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good morning, everyone. Scott Largent. Sorry, actually, good afternoon. It's been pretty busy out here, so just bear with me. We might have a little echo in the background. During the sweeps in the largest homeless encampment that we have now, basically in the United States, which is down the street from your county building, there were absolutely no services provided by our county or city. 2 San Jose police officers, basically Tucker Construction, a bunch of minimum wagers treating people like garbage. This would have been a great opportunity to bring out behavioral health, mental health, social workers, probation, parole, the public defender, everybody that we need out here. More people from the community, more people from law enforcement, and start addressing this big mop bucket that's out here. This is very shameful. And I really hope you 2 supervisors are starting to pay attention. It's field trip time. This is going to be very embarrassing because now it's on nationwide or nationalized news. So this is a joke. Come on.
The next speaker is Christy Connors. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Yes, hello, this is Christy Connors, and I am here speaking today on behalf of Bay Area Freedom Alliance. And I want to discuss the vaccines in relation to kids. 7 weeks ago, the Pfizer vaccine was approved for kids as young as 12. As the vaccines rolled out, so did the adverse events. California has a total of 25 pediatric deaths, life-threatening events, and permanent disabilities have been reported to VAERS so far since the rollout. VAERS reporting system has a 4 to 6 week lag time in the events that are filed. Therefore, 25 events took place in the first 1 to 3 weeks of the rollout. This is concerning because there's no discussion in regards to safety around children and the vaccines. There's only a discussion about boba trucks and how fun can we make this, and what celebrities can we bring out to encourage kids to get vaccinated. I really encourage you guys to look at the safety and not just efficacy, because you guys are harming children, and that is not okay. The state of California only had 23 COVID deaths in children.
The next speaker is Tino Bargon. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Tino, there you go.
Just to go ahead and add to the VAERS statement. VAERS is on the emergency use authorization fact sheet for the vaccines. The reports are not being taken seriously. Now, whether they've been confirmed or not, they are to be taken seriously. We paused J&J for 6 blood clots. Meanwhile, there are thousands of deaths, tens of thousands of severe injuries, and I'm getting censored on Santa Clara Public County Health when I talk about it. Meanwhile, we are bribing and coercing young children with tickets and lotteries and gift cards and junk food. That's not science and health. I don't know what that is. Meanwhile, Cal OSHA is discriminating against people who refuse to take the shots for whatever reason or can't take the shots, even if they have natural immunity, which for some reason is no longer a part of the discussion when it comes to herd immunity. There's some serious problems going on.
Next speaker is Melissa Smith. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Parents should be given freedom of choice and informed consent regarding the experimental COVID vaccination for children, as it has not been long-term safety tested. Also, now is no longer the time for masks in schools. The science shows that children are at a significantly lower risk from COVID than adults, including a lower chance of being infected by it and a reduced likelihood of transmitting the virus to others. My elementary-age son is hard of hearing and has difficulty breathing in his mask. He also has trouble understanding his teacher who wears a mask. Masks reduce the clarity of speech and lower it by about 5 decibels. In other words, speech is not just quieter, it's more muffled. Think about the learning loss for not only my son, who cannot lip read when people are masked, but all students who are not able to hear as well with their classmates and teacher masked up. With teachers all having had the opportunity to be vaccinated and children having minimal risk of contracting severe COVID, there is no public health justification for forcing children to wear masks in school. This fall, I'll be exercising my son's right to exemption from masks per the CDPH, but believe that all kids should have the right to learn maskless.
The next speaker is Ozell Kirkland. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. Over a month has passed since the health order of Santa Clara County, issued by Dr. Cody, established the focused safety measures with regard to the vaccinations. However, I urge the county to repeal this order and examine the latest scientific facts before pressing for more vaccinations. A growing body of evidence is reflecting far more concerns and risks to these vaccinations than benefits. As addressed in the recent peer-reviewed report I provided the committee, which reached the disturbing conclusion that for every 3 deaths the vaccine prevent, 2 people die, and adverse reactions occur with 4 others with serious side effects. Authors concluded this lack of clear benefit should cause governments to rethink their vaccination policy. This order also never explains specifically why or what to end the collecting lists of employees' names, the COVID-19 vaccination status will contribute to the health and safety, nor does it specifically identify how this list of names will be utilized. Weighed against the growing evidence, it is clear that I insist that this must be repealed in order immediately. Thank you.
The next speaker is Arisha. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, yes. To expand on the VAERS comment that other people made, there are over 6,000 deaths now in the US from this rollout, and according to a recent Harvard study, which I'm sure you're familiar with, only 1% is reported. So there are actually hundreds of thousands of deaths and huge numbers of hospitalizations and other side effects. I personally know 2 people who have severe side effects from the vaccines. One has Bell palsy, the other one has a shaking disorder related to Parkinson's or something. They're not given any support, they're not given any guidance, they can't get any financial support for dealing with their new health problems. And this is abominable. I grew up in the Soviet Union, and I didn't know that this country where I came from, hoping for freedom, would promote such horrible things and infringe of people's freedom of choice for their bodies and their health and their children, and children who will have long-term side effects in the future.
Our next speaker is Daryl Putnam. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. CDC did a 6-month study comparing areas in the country that had the most restrictive mandates to those that had little or none. The difference in infection rates between those two was as little as 1.7%. Same study compared areas with most restrictive mandates on restaurants to those that had little or none. Restaurants that were open completely. In those cases, the infection rates were 0.8% higher. CDC also reports that 99.7% of the people that contract SARS-CoV-2 have little to no side effects. I think the highest priority for the Board of Supervisors is to remove Sarah Cody from office and relieve the businesses that have been imposed with these draconian fines. Thank you.
Our next speaker is Danielle. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Eugenics is not a thing of the past, but unfortunately, it's largely ignored and there's little to no discussion on its influence on public policy. The pseudoscience of eugenics has a deep lasting roots within the inner workings of our current law, medicine, and public health. Public health and eugenics have a long history of testing vaccines on some of our most vulnerable individuals. Often there has been data outlining the dangers, yet these experiments are still carried out and justified in the name of public health. Pushing medical treatment on the non-consenting patients violates every protocol, the ethical performance on healthcare, and is what we are seeing today on a larger scale. The risks associated with COVID-19 shots are being censored and downplayed. The concerns are being discouraged when people are experiencing severe adverse effects and death from this vaccine. Why are we ignoring natural immunity when we know it's far more robust than that of the injected type? If you cared about the community, you would know that there are many that are feeling coerced into this. They are feeling threatened and intimidated into taking this vaccine. We will not allow our community to be attacked for making informed healthcare decisions. The benefit does not always outweigh the risk.
The next speaker is Rebecca H. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I am asking you to end the illegal state of emergency in Santa Clara County and the illegal mandates for employers to track employee vaccination status, and the illegal discrimination, segregation, and coercion of people who choose not to get the COVID vaccine. Start informing people about the risks of the COVID vaccine before they get it. Please remember who you work for. Thank you.
Our next speaker is Karen Ginkle. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. Nuremberg trials, crimes against humanity, experimental use, authorization only, voluntary, coercion, full informed consent, hydrochloroquine, ivermectin, budesonide, vitamin D, Fauci, Wuhan, gain of function, taxpayers' money, deaths, violations of rights, unconstitutional, tyrannical, overreach, perennial state of emergency orders, bogus PCR tests, vaccine patent prior to COVID outbreak, election audits, good versus evil, educated constituents, Bill of Rights, lawyers, recalls, cease and desist orders, serving of affidavits, awakening, mobilizing, watching, holding accountable, removing from office, taking our country back, county, state, and city. We are awakening. We will not pay your salaries anymore, and we do not consent anymore. Do the right thing, be on the right side of history.
Our next speaker is David Sussman. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
There are mandatory reporting laws when you see signs of abuse. I'm speaking today because I see blatant, obvious signs of abuse where the COVID shots are concerned. There's a 13-year-old girl named Maddie DeGarry who's been admitted to the ER 9 times since January and describes a pain so awful it feels like her heart is being ripped out through her neck. There's a woman with a case of Bell's palsy so painful she literally could not close her one eye for 1 month. There are hundreds of women who have not stopped shaking or tremoring for months at a time. This is a human rights emergency. People are being maimed. It's barbaric and grotesque. If this happened on a battlefield, we'd condemn it. If terrorists were doing this, we'd condemn it. When 2 separate 737 MAX jets crashed, killing over 500 people, that airplane was taken out of service for years while Boeing made sure that would never happen again. But when this destruction of human life comes out one end of a needle, for some reason we don't condemn it. Instead, we bribe teenagers with Warriors merchandise and free boba so that they join this massive human experiment. We must stop this abuse.
Our next speaker is Mary. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Local government effectively used fear to brainwash many people into believing the scam of the so-called pandemic. A little history: public health and eugenics go hand in hand beginning many years ago. The word eugenics eventually became unacceptable, but it didn't go away. Its ideology remained and used public health as its vessel. Public health has always been associated with bigotry. Communities need to be educated on eugenics' role in today's public health. COVID brought eugenics up to the forefront in broad daylight, proving it exists. When we hear for the community, this means individual health takes a backseat, and we're supposed to believe government knows best, just like in Nazi Germany. Just in Nazi Germany, physicians today are legitimizing these practices. Depopulation is their final solution. Look at the death of the elderly in nursing homes. It's all been planned. They use pseudoscience to scare the people into compliance. Under the guise of public health, the Nazis spread lies that Jews were diseased. Under the guise of public health today, they're spreading lies that the unvaccinated are diseased. Different century, same beliefs.
Next speaker is Latko. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. Me and my wife were born under a communist regime. What we see is that Santa Clara County abandoned individual liberties and has slipped into the same anti-constitutional common good ideology, where the common good argument is used by corporations and government tyrants to achieve their goals, and no price is too high, including loss of income and human life itself. Another thing, how can the health department explain why all businesses can open at full capacity, but public meetings by Santa Clara County government are held under Zoom? Are public meetings held under particularly hazardous conditions, or some animals are just more equal than others? Thank you for your time.
Our next speaker is Haberman. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Thomas Habermann. Please make any COVID-related measures and restrictions based on data, scientific studies, and facts, not on assumptions and estimates of so-called experts. For any measures you or the health department take, I would like to see some scientific studies behind them. And stop the illegal coercion and discrimination of people who choose not to get the COVID vaccine. Medical freedom and all our freedoms must be preserved. What country are we living in? Stop the fear-mongering and intimidation. Stop taking our freedom away. Obey the law, obey the Constitution. Thank you.
Our next speaker is Lori Joseph. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm here to speak to you today to let you know that I and many others from my community are not on board with the county's vaccination programs, masks, the illegal state of emergency, and any of the lockdown measures. The COVID vaccines are experimental and no long-term studies were conducted, and everyone taking the jab is the long-term study. Animal studies were skipped altogether. And moreover, the county is promoting discrimination and coercion by allowing and encouraging schools and businesses to require this dangerous experimental vaccine as a requirement in order to go to school, get a college degree, keep a job, enter a business, travel, and engage in the world. Please stop this vax program now because your constituents do not consent. Thank you.
Our next speaker is June Yang. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. June, are you there? June Yang? I will come back to Oh, there you are. Oh, no. Oh, sorry about that. Our next speaker is Leon King. I'm unmuting you. Please accept the unmute. You'll have 1 minute
I
to
don't know.
speak.
Are we supposed to wear them or not wear 'em?
It's not. Jeff Draper, I think you have your mic on. Next speaker is Leon King. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Can you hear me?
Yes, go right ahead.
Okay, so ever since these experimental vaccines have been made available to the public approximately 7 months ago, the VAERS reporting system has clearly demonstrated these safe and effective injections are nothing short of dangerous. Multitude of serious adverse events have been reported, including menstrual bleeding, myocarditis, severe neurological disorders, blood clotting, severe mental impairment, and death. In fact, over 6,000 deaths have been reported so far, which accounts for approximately 1 to 10% of the total deaths, as according to a Harvard study. To put this in perspective, there have been more deaths in the past 7 months from the COVID vaccines than the total number of vaccine deaths in the 15-year period between 1997 and 2013. To add even more perspective, in 1976, over 45 million people were inoculated for the swine flu, and after only 53 deaths, the program was halted because it was considered too risky. Right now, with over 6,000 deaths, over 21,000 hospitalizations, over 2,000 heart attacks, over 1,600 cases of myocarditis, et cetera, and yet these vaccines are still being promoted as safe and effective. This cannot stand. Thank you.
Next speaker is Amy Smith. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I have written CHHS regarding the masks to be an option for the upcoming school year, but have been told that guidelines are based on science and CDC guidelines. However, CDC states that fully vaccinated persons can consume all normal activities without a mask. Current CDPH and CHHS guidelines for K through 12 are that all students need to wear a mask regardless of their vaccination status. The CDC also recognizes those who are exempt from masks, but this is not recognized by the CDPH. Why are these exemptions not available? If following science, why is it that concerts, restaurants, stores, kids at summer camps, bars, clubs, even the White House press conferences can have upwards of hundreds plus people inside, mask-free, and be considered safe? Yet 30 children in a classroom can't have the choice to not wear a mask, whether fully vaccinated or medical necessary. Many of these classrooms are well ventilated, and traditionally desks are spaced apart. There's other states that have been fully opened and their cases are declining, not increasing.
I'm gonna go back to June Yang. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I fled communist China over 30 years ago. I have enjoyed freedom ever since. I love America. I strongly oppose the mandatory employer tracking of vaccination status of employees. Knowing the terrible risks of the so-called vaccines, we as parents have decided that our whole family, including our 2 sons, will not take the vaccine ourselves. Fortunately, my employer does not require me to disclose my status. Otherwise, I would feel my employer would be in danger. How dare you take away my right to protect my family with all the coercion? Are we now living under a communist rule? I will do all my best to fight this. Thank you.
Our next speaker is Blair B. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. Happy end of the fiscal year. Thanks for the words of Scott Largent at the beginning of public comment. I hope that you're creating a notification process and just people are heading out to the airport area to check on the situation. That's important. I wanted to talk about the health issues of the rent moratorium and people's health around that. And I thank you to the work of everyone, tenants, owners, local government and state government, really learning how to extend the eviction moratorium. I'm hoping the city of San Jose can work on a local level in the next few months to really better define what I think is state ideas to put the eviction moratorium off to March 2022. That would be awesome. How San Jose can work on that better at the local level. Good luck to all of us. Thanks.
The next speaker is Lan Nguyen. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Your DNA is your operating system. It tells your cells what to do and how to do it. This experimental vaccine injection hijacks that. It bypasses your operating system and sends an mRNA to your cells to produce the spike protein of the coronavirus. Think of the mRNA in the vaccine as a flash drive and your cells as a printer. You put the flash drive in the printer and it starts to print out produce type of spike proteins nonstop 24/7. You try to get the flash drive out, but you can't. This is what's happening in your cells. Vaccinated people are shedding these spike proteins through their breath, saliva, skin, sweat, feces, urine 24/7. If anyone is in contact with these spike proteins, it gets into their system. The spike proteins are the toxins. You don't want them because that's why people put on masks, wash their hands, and quarantine. But your body is now the manufacturing site for the spike proteins if you were vaccinated. Are you aware of this? This is information coming from a doctor.
Next speaker is FG. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'd like to just list the reasons why I think vaccines should not be mandated. Vaccine makers are immune from a liability, the checkered past of the vaccine companies, the ugly history of attempts to make coronavirus vaccines, the data gaps submitted to the FDA by the vaccine makers, no access to the raw data from the trials, no long-term safety testing, no informed consent, underreporting of adverse reactions and death. The vaccines do not stop transmission or infection. People are catching COVID after being fully vaccinated. The overall death rate from COVID, which according to the CDC's own numbers has a 99.74 survival rate. The bloated COVID death numbers. Fauci and 6 others at NIAID own patents in the Moderna vaccine. Fauci is on the hot seat for illegal gain-of-function research.
The next speaker is Michael Jordan. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Michael, are you there?
Yes, hello. The experimental COVID vaccines violate Article 32 of the Geneva Convention. Mutilation and medical or scientific experience not required for the medical treatment of a protected person are prohibited. The experiments are not lawfully or medically required, and we are protected persons. You are asking for 100% compliance with this injection tracking and tracing of an experimental operations system in violation of all 10 Nuremberg codes. Violation of these international laws carries the death penalty. The people of Santa Clara County are not on board with your coercion, physiological pressure, and willful violation of the Nuremberg Code. We are not on board with the destruction of our health, our freedoms, and our economy, nor are we on board with the rollout of your medical apartheid policies in workplaces, schools, and businesses based on vaccine status. Thank you.
Our next speaker is Ann Colton. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I strongly oppose the mass vaccination program rollout. It's an experimental injection, not a vaccine. People have a right to informed consent. Where there is a risk, there must be a choice. You work for us. I declare God's righteousness, justice, and truth will prevail in Jesus' name. Amen.
Our next speaker is Melly. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello. Yes, I only have one thing to say. Sarah Cody needs to be terminated immediately. Thank you.
And that concludes our request to speak.
Thank you, Mr. Clerk, and forgive me, folks, if my camera is on and off. I have some bandwidth issues, I believe, and so I'm trying to make sure that we have at least good audio running in both directions throughout. All right, so I'll look to the clerk. We have concluded public comment. Yes, sir?
We have one late arrival.
I'm going to ask that we take that late arrival, please.
All right, and we have another one. Okay, next
Actually,
speaker.
at that point, hang on just a second. Those two do have to be our final speakers, please. Thank you.
Okay, last two. That will be Bryn and Roman. Next speaker is Bryn. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, thank you. I actually signed earlier. So I'm actually one of the injured people from the COVID-19 vaccine, and I'm undergoing a lot of medical procedures that will cost a lot of money as a result. As a scientist, I see that this vaccine now perturbs the innate immune system, seems to activate unexpressed genes, and also perturbs the nonsense mediated mRNA decay and could have implications for non-viral diseases. A question to Dr. Cody, which I see she studied at Stanford. How comes you never talk against the PCR test amplification cycle used incorrectly at 45, where it was actually showing a lot of noise and not the actual virus? As a result, there were false positives. A Stanford graduate and Yale graduate couldn't really see the potential issues.
Our final speaker is Roman. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Roman.
Yeah, hello, can you hear me?
Yes, thank you very much. Go ahead.
Yes, so I am medically exempt from vaccine because I would have severe reaction if somebody will try to inject me. So in this way, if someone will put a decision that everyone needs to be vaccinated, you basically will kill me. I would like to make sure that Santa Clara County will not put anything in the papers that will kill me. Thank you.
And that concludes our request to speak.
All right. Thank you again to the clerk. Thank you to members of the public who took this opportunity to speak under public comment. A gentle reminder that folks who have spoken to a particular topic under public comment, if it is agendized, are unable then to speak when we get to items later on the agenda. And I'd ask everybody to respect that if and when the time comes. That takes us to item number 3, which is to approve the consent calendar and changes to the committee agenda. And Supervisor Lee, I think what I would like to ask, if you're amenable, is that we approve the consent calendar as contained in our published agenda with 2 changes. One is that item 12 be moved to the consent calendar. This is the item that you and I have previously pursued on the Santa Clara County Asian and Pacific Islander Health Assessment. That could be moved, I think, to the consent calendar, but I do think it would be helpful to bring item 14 onto our regular agenda in its place. Is that agreeable to you, Supervisor?
Yes, it is. Thank you.
Can I get a motion to that effect, please?
Okay, so moved.
Thank you for that. I will second. Let me look to the clerk. I see we have 2 folks who'd like to speak to the consent calendar. Yes?
Yes, indeed.
All right. And I will just ask that they limit their remarks to 2 minutes. And I will also ask that they be sure that their remarks really are focused on our consent calendar, since we have a very packed agenda today. I'd appreciate any courtesy they could extend the committee and members of the public. Go.
The next speaker is Blair B. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you. Blair Beekman here. To try to address working partnerships issues to develop a healthcare public meeting process and just behavioral health ideas that can be a part of the Asian Pacific item. I'm very concerned about the current state of the VTA light rail bus bridge service. It's not happening along First Street. All the other light rail stations have bus lines that can go by the light rail, it can be covered, but not along First Street and from Tasman to downtown. There's a lot of population that's low income in the First and Gish area that will not be receiving bus transportation at this time. There's a county health facility and probation department along First Street. There's the VTA along First Street. This is a health issue, I think. And the VTA, to totally respect the grieving period we're in, it's now time that from this grieving period, we need to start to reflect on what are our better practices and our better transit operation ideas. And that means a simple, shuttle bus service from Tasman to downtown can easily be covered, I feel, and its funding can be covered. It is not as demanding as a whole array of bus bridge service at this time. I hope you really can work on it and talk to the VTA about it. Thanks for your patience to hear me out at this time on this issue. Thank you.
Next speaker is Scott Largent. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everybody. Scott Largent. Item number 20 on the consent calendar about the behavioral health system, the Contractors Association. The reason I'm commenting about that right now is they need to start coordinating with law enforcement, Tucker Construction, the cleanup crew right now, to be able to get these nonprofits out there to truly help people. I'm really wondering where all the money's going, why it's not making it to people on the streets, and why no one is showing up. Blair Beekman brought up something right now, and he basically knocked it out of the park right now. There is no system right now for people to really get around. And I'm very compassionate about what happened at the VTA facility. But you have close to 600 people in the largest homeless encampment in the United States that can't get to probation and parole. They can't get downtown to go to any court appearances. They can't get to a shelter. They can't get to their medical appointments. We need to start figuring those things out, and we need to get more people out here. This has to be embarrassing to all of you right now. This is getting some serious attention out here right now. Remember what happened with the jungle when they tore that place down? That was all over the news. And this is what's happening out here right now. We're getting more and more people from outside the area coming in here. We even had a man that's running for governor, for the recall thing. He brought his big campaign bus out here yesterday, started doing press conferences, showing how horrible the conditions are out here. And this, reflects our leadership in our county. I'm begging you guys to start getting involved and get down here. Send your people out. Make phone calls. Please, waving the flag. Thank you.
That concludes our request to speak.
Thank you. Then I believe you can call the roll on item number 3, which is approval of our consent calendar with 2 changes. And the 2 changes again are item 12 has been moved to consent, and item 14 will take its place on the agenda. So eventually we'll be doing 1 through 11, then item 14, and then item 13. Thank you.
Chair Simitian, may I ask to speak on item number 20?
Absolutely.
Thank you. It's on the consent calendar, and I just like to request the administration to provide regular updates from the BHSD and the VHP on their progress towards addressing the Behavioral Health Contractors Association, also the community health clinics concerns, particularly relating to the concerns presented by BHCA regarding the impact that delays in pay and credentialing that would have on the hiring process. Thank you.
All right, duly noted, and that request will be part of the action on this item. Call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simitian.
Aye. Motion carries 2-0. Thank you. That takes us to item number 4. Do we have Dr. Kranis here to present?
Yes, good afternoon, Board of Supervisors. Thank you. I'm here to present my name is Yvonne Kranis. I'm the Enterprise President of the Medical Staff, and I'm here to present the Enterprise Credentials Report, as well as the Enterprise Emergency Medicine Privileges for approval.
Thank you. We have them before us. Supervisor Lee, can I get a motion to approve?
So moved.
And I will offer a second. Let me check with the clerk, see if we have any speakers on this item.
There are no requests to speak.
Please call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye.
Thank you.
Motion carries 2-0. Thank you very much. Thank you, Dr. Kranis.
Thank you.
Glad to have you with us today. That takes us then to item number 5. And this is our opportunity to just check in again with respect to the report on Child and Adolescent Psychiatric Facility and the Behavioral Health Services Center that is proposed for our Valley Medical Center campus. We have the written report in front of us. Mr. Draper, are you here on this item?
I am here, but of course, as usual, Supervisor, I'll turn it over to Doug Koenig to give you the quick brief.
All right, Mr. Koenig, let me just ask you a couple quick questions in the interest of time. I noticed that we still anticipate construction through August of 2023, staffing and stocking through November of 2023, and then a open date at about that time, November of 2023. Do I have that correct?
Yes, Supervisor.
Thank you so much. And I have 2 questions for you. Under OSHPD, I think I raised this previously, and forgive me, I just don't remember the answer. We have on our chart here at page 2 of 5 on packet page 37, the black print on the white page says that OSHPD review will run through January of 2022, next year. But then down in the bottom in the little red arrow, it says 13 months running through March of 2022. Do you recall, I just can't recall, and I apologize, what the explanation for that difference is, or is it just 2 different estimates that landed on the same chart?
I believe it's, I thought we had corrected that. It's not 2 different estimates. It's March 2022 now, only because of the collaborative review, the incremental review.
Okay.
I mean, for the final, for the approval of the final segment, the increment.
All right. Well, if we just ask that we correct it on subsequent timelines for the purpose of clarity, that would be helpful. And I'm going to make a note on my own chart. This is the one that's real. Okay. And thank you for that. And then wanted to get a quick check-in with you. Page 3 of 5. The first bullet at the top of the page indicates staff indicates issuing a notice to proceed to Excel, the construction manager, the construction company rather, notice to proceed to Excel for the preparatory work and demolition of the parking structure 3 by June 21st of 2021, a date of course which is come and gone. It does indicate that the start of demolition may be delayed due to the late identification of a requirement to relocate a lift station control cabinet. And I have to tell you, I would be kidding you if I said I understood exactly what that meant, but can you shed some light on both what that means and where we ended up in terms of timeline?
Well, in terms of timeline, for one thing, we did issue the notice to proceed yesterday, so June 29th. 8 days following what we had projected. As far as the lift station, it's a controller. There are 2 lift stations, one for sewer and one for stormwater. So what happens is when you can't get gravity flow, you run your pipes to a basin, and when it reaches a certain level, pumps kick in, and it raises the level or it pumps that to another set of pipes, which starts at a higher elevation. So all the controller does is read those indicators for the level and then turn the pumps on when necessary. In regard to that, we thought we were initially looking at a 12 to 14 week delay. They've found a workaround on that, which would, if approved by OSHPD, would result in no delays to the demolition. But again, that depends on OSHPD approval. They have a special process that reviews small changes which affect the critical path, and they actually discuss those 2 items. There's the lift station. There's also we found we need to reroute some low voltage cable. We discussed both those with OSHPD today, and it looks like they will they will at least give it a look once we get the designs in front of them.
All right. As things now stand, do we know when we'll get a thumbs up or a thumbs down on the workaround?
The projection, no. We have some time though. It's going to take XL time to mobilize. Now that they've got the notice to proceed, it's going to take them time to, get out there, start putting their fences up around the construction site. They need to do some potholing to actually locate utilities that they either need to avoid or relocate. And I would expect if OSPA is going to allow us to go this route with the expedited review, that these will not delay the project.
All right. As things now stand, Mr. Koenig, this is the monthly question, of course. Do we still anticipate we can meet the project schedule timeline contained at packet page 37, page 2 of 5, with a November 2023 completion date?
Yes, we do, Supervisor.
Thank you. And Mr. Ohashi is on the meeting line here. I'd like to ask him the same question. Mr. Ohashi?
Yes, Supervisor, we are on time.
How about Mr. Sodi?
Yes, sir, we're on time.
And Mr. Lorenz?
Yes, Supervisor, we are on time.
Thank you. Mr. Draper?
Sir, we're tracking well.
Thank you. And Dr. Smith?
Yes, at this point, we're on time.
Okay. Looking forward to getting the same answer every month in the future if we can, gentlemen. That's the plan. Supervisor Lee, if you have any questions or comments, now is the time. And if not, this would be a good time to simply move approval of the recommended action, which is to receive the report.
Yeah, thank you, Chair Simidian. My question is actually related to demolition of the parking lot and where people are going to park. I received some comments from some employees saying that there's a lot over in Thornton Ember that was not unused, and whether that would be a potentially good place to help provide additional parking when parking structure 3 comes down. So that's some questions if you could help answer, I appreciate it.
Is staff prepared?
I'll take it. This is Jeff Draper. I'll take it. Yes, that lot can be used, Supervisor. We're obviously making sure that the lot's fully functional, available to everyone that can park there, and that it's well lit and signed and so forth.
Great, thank you. That's all I have, and I'm ready to go ahead and move on approval of receiving the report. Thank you.
Thank you. I have a motion by Lee and a second by Supervisor Sumidi, and that would be me. Let me just confirm with the clerk that we have no speakers.
We do have a request to speak.
Let's take that speaker, please.
The next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Scott Largent. I participated throughout the last couple of years in almost all of the meetings that pertain to building this new psych ward at Valley Medical Center. I understand that the push originally was to provide this for adolescents, which I think is extremely important. Don't get me wrong on what I'm saying right here. What I'm confused about is our existing psych ward, why we're running that place into the toilet. I understand eventually we will demo that building. I mean, it's a shameful facility, but why are we building killers here in Santa Clara County? Why do we run all this stuff into the ground? It seems like we could still utilize that. I'm just a little confused. My main concern is the people that get taken there are let out within 2 to 6 hours and they never really get adequate care. I say it over and over again. I mean, is there a way to get some, temporary trailer buildings? I remember growing up in Saratoga when the schools started to get kind of packed, they started putting portable buildings in the back. And I know they do this a lot at Valley Medical Center. Do we have an opportunity to start doing something like that? I worry that no one is paying attention to the mentally ill and homeless that are literally in the middle of traffic, butt naked, smoking meth that need help. I mean, now they're just getting run over. I'm a broken record. I worry nobody's paying attention, and this is a humanitarian crisis that you guys need to start addressing now. And I'm very confused. And I like Otto's comments about the parking situation there. But why don't we turn those into a little tiny home psych ward or something like that, and make everybody kind of park a little farther down the road, and we can really help the people that are suffering. We really need to start figuring some things out. Thank you.
Next speaker is Blair B. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. I am 52 plus years old. I've become a bit confused about how to address psych ward questions and the questions of psych treatment versus the jail system and the psych ward questions that you're building for the future of the jail system. I guess I just simply wanted to note that at this time. And I know with all the new construction of the jail you're going through, and with this item about the future of a new psych ward, how you balance those questions about jail mental health versus mental health Valley Medical Center. Good luck how you balance and address those questions. I would like to learn more what exactly those questions are and that balance is. And I'll be looking forward to better understanding that in the future. Thank you.
And that concludes our request to speak.
Thank you very much. Let's go then for a vote on the motion, please.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye.
Thank you.
Motion carries unanimously. That takes us then to item number 6, which is the opportunity to hear our regularly scheduled report on COVID-19. I believe we have folks from public health available. And I know we got an extensive report last Tuesday at our full board meeting. So Supervisor Lee, I want to alert you to the fact that this report will be somewhat briefer given that recent report. But of course, I'll turn to you for questions and comments immediately upon conclusion of the report. Go right ahead. Who's with us from public health today?
Thank you. This is Dr. Sarah Cody. Good afternoon, Supervisor Simidian and Supervisor Lee. This report will be quite brief, just 2 slides. If I could show the first slide, just to, as always, give us a sense of where we are in the trajectory of this pandemic. Right now, our daily case counts are low and flat, and we hope to see them decline even further or at least remain flat. The stability of our case counts is in large part due to the relatively high level of vaccination. And in the next slide, you can see a bit more detail regarding vaccination. As you likely heard at the last board meeting, our county, among large counties in the United States, we have the highest level of vaccination among any large county in the entire nation. Nearly 75% of eligible residents 12 and older have completed their vaccination, and over 80% have at least 1 dose. The groups broadly that are lagging comparatively, fewer men as compared to women have been vaccinated, and the Latinos and whites are less vaccinated as compared to Asians. I think I will conclude my report now and simply answer any questions that you may have. Thanks.
Thank you, Dr. Cody. And let me turn first to Supervisor Lee. Then I will have just a couple of questions, and then we'll go to public comments.
Yeah, thank you very much, Dr. Cody. First of all, I just want to thank you for your work. And I want to just address some of the comments made before the meeting. Quite a few individuals have concerns about the vaccines. And I certainly am interested in learning more about the sources. And I would like to ask the speakers to please email my office with the sources of the information they could share with me. My office email address is supervisor.lee@bos.sccgov.org. Now, from the source of information I've been getting, which I read, like the New York Times and the CNN, what I've been learning, and Dr. Cody, please correct me if I'm wrong, this Delta variants are running pretty rampant. It seems like it might have started in India, but now it's all over the world, including UK, Australia, and even countries like Israel that has over 60% of the residents fully vaccinated has now imposed either lockdown or other type of measures due to the Delta variants that seems to be very transmittable and might be harder to deal with. And now that the World Health Organization is also recommending the wearing mask indoor, I would like to ask is, are we having any type of changes on our recommendation now regarding the wearing of mask indoor moving forward?
We are also concerned about the Delta variant. We are watching it very carefully. As you know, we do have the ability to sequence specimens, and so our tracking is quite good. The best defense against the Delta variant is actually increasing our vaccination levels to the highest degree possible. So it is true that the Delta variant spreads more easily and likely causes more severe disease, which means that the percent of population that needs to be vaccinated to protect those who cannot be vaccinated then needs to be higher. So that's the most important thing that we can do. I do know that some jurisdictions have recommended indoor masking, such as LA County. We have not made a recommendation as yet in Santa Clara County, but it is certainly something that we are watching very carefully. And as always, we'll make our decisions to ensure that we best protect the health of people living in our county.
Thank you, Dr. Cody. Now, in terms of the vaccinations, at this point, my understanding is that we no longer have a supply shortage of the vaccines. Am I correct in our county?
The supply is plentiful here in our county, across the state, and indeed across the United States.
Great. Now, with the countries we talked about, obviously, our airport is one place where a lot of travelers to come into our county, either in or out. Have we considered maybe having some type of vaccination sites at the airport? And if we haven't, what are the steps we might need to take to make that happen?
I honestly, I don't recall if we've had those conversations. That's certainly something that we could consider and discuss. So we're happy to take that back.
I can jump in on that a little bit. We did talk about it. There are a lot of operational issues that would be challenging to overcome in terms of the wait times and observation and lines and security and the like. But we certainly can look at it again.
Thank you, Dr. Smith. I think it's something that we should consider and look at. And if it can be, if it cannot happen due to all these things that we identified, that's one thing. But I certainly want to look at it in case if there's something that could be happen. I think it would be helpful. I do know that quite a few airports, and I was in Hawaii back in November, where they have on-site testing. That I actually went through and get the negative test back in about like a couple of hours, and they went through the whole process. It was, it was actually quite painless, to be honest. So that's certainly something that has been done for testing. So I certainly would like to see if we could actually have actual vaccination. To me, might be even more effective. So if we could look at that and get back, I would really, really appreciate if this could actually happen. Thank you very much, Dr. Smith.
Sure, we'll look at it.
Thank you. And that's all the questions I have, Chair Smitty.
Thank you. Dr. Cody, two issues. I know that you and your public health department staff and folks who have been seconded to the department had a chance to listen to public comment earlier, where we had a number of folks express concern about their perceptions around safety of the vaccines and particularly safety with respect to young people. I wonder if you could just share with the committee and with the public what efforts you and your team have taken to assure yourselves and again our board and the public that the vaccines in use are safe both for adults as well as now for minors who are currently eligible.
Thank you, Supervisor Sumedian. One of our challenges now with the rollout of vaccination, of course, is the terrific amount of misinformation and indeed harmful information that's circulating. Every vaccine, there is no therapy or no vaccine that doesn't have a downside. Just like when you get in your car, you take a risk that you trade for the ease of driving in your car to get somewhere. So it's really a weighing harms and benefits. And there is absolutely no question that the benefits of the vaccine far outweigh the risks. The benefits far outweigh the risks in every age group. So the benefits to the individual are much greater than the risks of the vaccine. And when the entire community gets vaccinated, it protects those who are unable to be vaccinated or who might not get full protection from a vaccine, such as those who are immunocompromised. And I think it's really, really important not to lose that point that you get vaccinated to protect yourself and to protect your family and your community.
All right, thank you. And Dr. Cody, you know this is a question I bring forward. Latest information or understanding about the potential need for, or desirability of booster shots at some point in the foreseeable future? Any update there?
The information that I'm hearing actually is that for the mRNA vaccines, the response is, the durability may be longer than initially thought. So I don't know whether we'll need boosters. There's also another question on the table, and that is regarding the worldwide shortage of vaccines and whether the United States would have booster shots when there's other countries indeed right on, bordering our country where vaccination rates are so low. So I think it's a complex discussion and no opinion has been rendered as yet.
All right, thank you. Let me just see if the clerk has folks who have not yet spoken who would like to speak to this item.
We do have some requests to speak. I think I can identify some that have not spoken and some that have. So I'll go through what I can
Again,
tell.
folks, if you've already spoken to these issues during the public comment portion of the agenda, I would ask that you not speak now. We have a number of important issues on the agenda today, and your concerns have been heard. So rather than ask us to referee, I'd appreciate it if you could respect that process. And I'll ask the clerk to go ahead and call folks to speak who have not yet spoken on this topic. Go right ahead.
The next speaker is Blair B. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Forgive me, Mr. Clerk, how many folks do we have lined up to speak on this item?
We have 4 requests to speak.
All right, we're going to cut it off there and we're going to go to 1 minute. And I apologize to folks for having to cut it to 1 minute, but given the lengthy public comment we have, we really do need to be brief in the comments here. Go right ahead. We'll go back to 2 minutes. Actually, forgive me, folks, leave it at 2 minutes, but folks, if you could cut it to 1 minute, that would be helpful. Go right ahead. Thank you.
All right.
Sorry for the back and forth, everyone.
Sure. Blair B, I'm unmuting you. You'll have 2 minutes to speak. 1 moment, please. Go right ahead.
Thank you very much, Supervisor Sumedian, for allowing 2 minutes. I hope I can speak directly to COVID-19 issues on this item. This is the first time I'm in the presence of Dr. Cody. Thank you for her being here today. A thank you to Supervisor Lee. I thought he made some really interesting comments. I'm interested in a lot of what the public commenters had to say also. Very interesting to get a bit more factual information about 6,000 deaths plus, that's, 6 to 50,000 deaths. That's a lot. So that it's something to look into. And, with this process, this vaccination process that we're in, there's a lot of questions. And I think, in the past few months, a lot of those questions have been debunked and can be answered. And, we've been doing this sort of vaccination process with the protein process for, I think, at least 20 years now. So it's not anything totally new. I am a bit worried. Dr. Cody gave a really great description that it's a balance, and we're balancing health concerns of a community versus, what could be the effects of the shot. And, she's offering that there is a herd immunity idea and just basic health of a community that we have to consider in the questions that public comment asks. So thank you we're trying to work on that balance. All I can try to ask is for, all of yourselves at the government level to learn how to just be direct about the conditions of what can happen with the vaccination and the entire process. It's not just indirect methods that we slowly learn and it seeps out how we learn about this process. Learn in this public comment time how to be direct with exactly good information that you can share. Thank you.
Our next speaker is Christy Connors. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. Timer will start when you begin speaking.
Yeah, hi. I'm commenting directly on something that Dr. Cody stated. Dr. Cody stated the
Connors,
variants.
excuse the interruption here, and let me ask the clerk to pause. I have a record here of who spoke earlier under public comment.
Scott Largent spoke 3 times earlier, so I request respectfully that you would allow me to speak because the information is different that I'm speaking to. Scott Largent has spoken 3 times and Blair has spoken twice.
Please cut the speaker off. Please do. Thank you.
Our next speaker is Scott Largent.
Just one moment, please. We have a list of folks who've spoken earlier under public comment. If the folks who spoke under public comment spoke to COVID issues, notwithstanding the fact that it was an agendized item, then regrettably, this is not a time when they can be permitted to speak yet again. Mr. Largent has spoken on other items, not on COVID items, as I recall. Mr. Largent, you want to help clarify and remind everybody what you spoke to when you spoke on public comment?
Correct. I was speaking pretty much about the issues out here at the FAA crash zone and the homeless and mentally ill. I didn't discuss anything involving COVID yet.
All right, thank you. So again, folks, we keep a list of folks who speak under public comment. We ask, as always, that you speak to the topic on the agenda. Probably more than 20 chose to speak to the COVID item, even though it was later on the agenda. We, as a matter of convenience, tried to accommodate that, but again, quite explicitly asked that you not speak twice on the same item. That is consistent with the rules. Mr. Largent, forgive the interruption. You have your 2 minutes. Go right ahead.
Thank you. Thank you. I appreciate that, Joe. I appreciate the conversation right now. I am a little confused. I know a lot of different places as they open up, wear a mask, don't wear a mask. I've done this now for the entire portion of COVID, and I just have no problem continuing to wear my mask when I'm indoors or around gatherings of people. I really like the approach, Supervisor Lee, of providing contact information and kind of vetting out the public in a way. Because let's be honest, and I'm sure I'm going to tick a lot of people off, it sounds like half of our audience from the public today is putting the foil over the head. And we're able to vet that out right now by kind of addressing their issues, talking with them, finding out they really are a scientist, they're really a doctor, if they get out of their basement very often, you just never know. And I really appreciate all the hard work that you have put into all of this, Dr. Cody. This must be the most stressful thing in the world. And I think you've done a top-notch job. And it just must be really hard to get some of this brutal feedback from people. And some of them, I don't think they know what they're talking about. Now, some of them, I do think they know what they're talking about. And thank you, Joe, for kind of leveling things out with what's going on in public comment. I try to stay in my lane and talk about issues that affect me. And I do appreciate you doing this. So I'm going to cut it off at that. Thank you.
Thank you. Next speaker, please, looking to the clerk.
Next speaker is Tino Bargon. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
And forgive me, but I believe that
It is a violation of federal law to
All
falsify.
right, let's cut this one off, please. I apologize, folks, but again, this is someone who spoke earlier, and I feel sure heard me when I said that public comment was for items that were not agendized, and that if you were given the courtesy of speaking, even though you were talking about an agendized item, that would preclude you from speaking later when we got to this. Let me check one more time.
That concludes our request to speak.
All right, thank you very much. Then do we have a motion to receive the report from Supervisor Lee?
Yes, so moved.
Thank you, Supervisor. I will second. We will call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. The motion carries unanimously. Thank you very much. And again, folks, happy to try and accommodate as much public comment as we have, but cannot accommodate it twice. And I feel a little disappointed that the very direct request to speak to agendized items when they came up on the agenda was heard and ignored by close to 20 plus folks, and then a couple of other folks coming back. We just want to make sure you get heard, but we can't let that process get out of hand, or it will preclude deliberation by the committee and comment by the public on other items of importance. Thank you very much. All right, that takes us then to item number 7. And item number 7, of course, is the report on the sexual assault forensic exam SAFE program report. We have a memo in our packets from Mr. Lorenz, Chief Executive Officer at the Valley Medical Center. We want to, I think, Supervisor Lee, I think the way I'd like to recommend we go here is to have an initial presentation by Mr. Lorenz and his team, and then hear from the public before you and I engage with comments or questions. Does that work for you, Supervisor?
That's perfect. Thank you.
All right, and we have a lot of information in our packet, but we'll turn first to you, Mr. Lorenz, and to your team. I see both Kim Walker and Andrea Berlini. So what would you like us to know?
Chair Simidian and Supervisor Lee. Joining me, of course, is Kim Walker, our nursing program director for the SAFE program, and of course, Andrea Berlini, who is our nurse executive over emergency and critical care services. So with your permission, Supervisor, I'd like to turn this over to Kim Walker for a presentation, and then we can move into questions and answers.
Thank you very much.
Kim.
Yes, can you hear me okay?
Loud and clear, thank you.
Thank you. So good afternoon, Chairperson Simidian and Vice Chairperson Lee. My name is Kim Walker, and I am the nurse manager for the Adult Adolescent Sexual Assault Forensic Exam Team, or SAFE team. And we respond to the patients who are 12 years and older after sexual assault. And today we just want to provide a short overview of the SAFE services and the response locations in Santa Clara County. So I'd like to take a moment quickly to clarify some of the terms related to the SAFE program that are often used interchangeably, but have different meanings. So when we talk about SART, that's traditionally been the term used for this practice. That is really the penal code defined collective that refers to the multidisciplinary group of partners that respond. So the DA's office, law enforcement, crime lab, the confidential advocates, and our SAFE examiners. SAFE is what we do, and we are part of the SART. And we are the specialized healthcare providers that provide the medical and forensic care to survivors after sexual assault. And then we talk about the response locations. We're talking about the facilities where we respond and the safe services can be provided by our team. So when we do that, when we do respond at these response locations, there are specific elements of care that need to be provided at every place, regardless of where we are. What we do is we provide best practice trauma responsive medical care. We obtain relevant medical history and information about what occurred. That helps drive our exam. We do a physical head to toe assessment. We secure the time sensitive evidence. We take digital images and we document those findings. We provide medications for sexually transmitted infections and emergency contraception. We also provide shower services, food, and clothing. And it's really important here to note that all of our safe care is provided only with the survivor's consent, which they have agency to provide or rescind at any time, and that these services are free of charge to them. So in the last 2 years, we've had significant expansion of our services, both the team and our services. What we've done is, starting in 2019, we started to look at how we could improve. And then in 2020, we successfully opened 2 additional safe response locations at Stanford Healthcare Emergency Department in Santa Clara and at Dominican Hospital in Santa Cruz. Also in 2020, we began offering our safe exams for instances of non-fatal strangulation cases that do not include sexual assault as part of a multidisciplinary pilot program. But we've only been providing that at Valley Medical Center location up until now. And in 2021, this year, we will additionally expand to add 2 more response locations, one being at the Children's Advocacy Center and the other at St. Louis Regional Hospital in Gilroy. We will also expand our strangulation exams at all response locations. And then we've added new coded positions to help stabilize the response coverage required and to support the alignment of both the pediatric and adult safe services. The pediatric team, they see patients 11 and younger. So as we expand these services, we want to make sure that the efforts and the service provision are meaningful at every safe response location, both to survivors and to our stakeholders, our partners in SART. So we've added quality metrics and identified improvement strategies. These are important because our response is dynamic, requires ongoing quality assessment to ensure that our forensic services align with both legal and regulatory and medical requirements, that we consider the survivor's voice and experience as a key driver to affect improvements in our safe services, that we improve our community awareness and understanding of safe services and the response locations, get the information out to everybody so they know where to go and how to access care, and the importance of immediate medical care for survivors, which is particularly important with the non-fatal strangulation cases that we've been seeing. We also want to optimize the data for our Safe SART response across the continuum of care, from the time somebody would call 911 to the time that their case may be adjudicated, and every on and off ramp along that process. We also want to innovate our training practices for safe examiners so that we can increase access for survivors. And then we also want to act as a resource to our SART partners and other safe programs to ensure that, lift all boats, so that what our baseline is and their baseline is, we can share information for the purpose of increasing and improving our response to survivors. So that was our very brief overview, but we are happy to answer questions.
Thank you. Let me just ask, anything else from Ms. Berlini or Mr. Lorenz before we go to public comment?
Not at this time.
All right, thank you. And Supervisor Lee, you will recall, and I'm sure members of the public will have a range of knowledge on this topic. This item is before our committee again for this conversation, in part because we had some expression of concern from folks in the community about the experience at the Stanford campus with the SAFE program. I brought a referral to our board at the June 22nd meeting asking that we not only do a deep dive on that particular set of concerns, but use this as the opportunity to review the status of things at the other two sites here in Santa Clara County, meaning the VMC site, as well as the planned South County effort. The report we have in writing and that we received just now references, of course, the Santa Cruz County effort as well. So I just wanted to sort of put a marker on that, and also references a Monterey County possibility that was helpful for me to learn about. The action that the board took at my request on June 22nd, which prompted this report, was that we not only have this report today, but that we also engage the services of our Harvey Rose management audit team that contracts independently with our board, that we refer the matter to our county women's commission as well, and that we direct the staff, as we did at that June 22nd meeting, to take whatever steps they thought necessary and appropriate to improve services immediately based on their own knowledge and understanding of the situation as informed by community input. So that's a lot of background, and I apologize for that, but it struck me that perhaps some context would help frame the conversation, but also the public comment. I do see that Dr. Smith has his hand up, and I want to go to him if he would like to speak. We do have 5 participants whose hands are raised, and I will get to them very quickly, I promise. Dr. Smith.
Yes, thank you, Mr. Smidian. I wanted to also put a little context on the discussion because there's a lot of people listening. I know that the committee and the board will be talking about the locations for exams, but I just wanted to reaffirm for the subcommittee and for the staff's benefit that our SAFE team is among one of the best in the nation. We have been very innovative and very responsive, and the collaboration we've had with the SART team and the DA's office specifically, including the CAC, has been really state-of-the-art kind of service. So the people actually doing the work are doing a great job. And I know there's questions about the location. Those issues obviously need to be discussed and thoroughly vetted, but I want to make sure that our staff knows that we're not really talking about the quality of their work. They do a fabulous job, and I want them to know how we feel extremely lucky to have them working for us, doing this extremely difficult work.
Thank you. Thank you for that. And we'll go to the speakers. Let me ask how many speakers we have in the queue through the clerk.
We currently have 8 speakers right now.
Let's go ahead and accommodate 2 minutes per speaker, please. But we do ask that if you would like to speak, you sign in here in the next minute or 2, because we're going to have to cut it off in 60 seconds, please, through the clerk. All right, let's go to the first speaker.
The next speaker is Allison Kerr. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, Supervisor Smidian. I'm confirming you can hear me?
Yes.
Thank
and this is Supervisor.
I'm Allison Kerr. I'm one of the vice presidents at Stanford Healthcare. I'm also a nurse. Stanford Healthcare cares deeply about the welfare and safety of our patients and our broader community. We welcome the opportunity for evaluation and embrace the spirit of continuous improvement while keeping our survivors' well-being top of mind. We operate in a state-of-the-art emergency department that's a level 1 trauma center for both adult and pediatrics. And we provide all the emergency care elements that a survivor might need. We've created private space where survivors can be evaluated as soon as we are aware that they are a survivor of sexual violence. We want to ensure the dignity, respect, privacy, and confidentiality of survivors during this most devastating time. While we have not received any direct patient complaints regarding Santa Clara Valley Medical Center sexual assault forensic exam program at our location, we are concerned about complaints from anonymous sources. We would appreciate the opportunity to address any concerns and encourage them to reach out directly to us. All conversations would be held in the strictest of HIPAA compliance and confidentiality. In collaboration with Santa Clara Valley Medical Center SAFE program, Stanford Healthcare successfully meets all regulatory requirements and strives to provide the most sensitive, supportive, and highest quality of care to both adult and pediatric survivors of sexual violence. We thank Santa Clara County for their partnership in bringing these important services to our broader community. Thank you.
Our next speaker is Michelle Dauber. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, I'm Michelle Dauber. I'm a professor of law at Stanford. At VMC, every survivor is examined in a suite that includes a dedicated exam room, waiting room, shower, and restroom. There is no similar dedicated space at Stanford. In November of 2018, President Tessier Levine promised in writing that a space can be provided, and that is a quote, at Stanford Hospital for these exams. This space was initially identified, but then Stanford reneged on its promise and no dedicated location has been provided by Stanford. There is not a dedicated private waiting room. Conditions are described as being traumatizing at Stanford. Recently, a student rape victim reported that they had waited in a state of trauma for 3 hours after being triaged in public twice by 2 different Stanford personnel in the ED waiting room, throwing up and crying until they left in despair without receiving a safe exam. Stanford President Mark Tessier Levine was informed of this situation weeks ago and has not taken action necessary to remedy it, despite his promise to do so. Instead, Stanford sent the county a tone-deaf, offensive letter listing the credentials of its fantastic doctors and denying that it has received a complaint, presumably even the complaint that President Tessier Levine himself received. There is clearly a disconnect between the very real problems that are being reported and that need to be addressed, and the fact that Stanford is not even acknowledging the problems, let alone fixing them. For that reason, and with a heavy heart, I encourage you to temporarily pause the SAFE pilot program at Stanford and return this service to Valley Med until these problems can be thoroughly investigated and addressed. The trade-off of a shorter drive to Stanford is not worth the risk of the trauma that is being described. Thank you.
Next speaker is Ari Gabriel. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, I'm Ari Gabriel. I'm a junior at Stanford University and co-director of sexual violence prevention. I want to second what Professor Dauber said, and I want to say that it's incredibly concerning, especially when we have multiple freshman classes coming onto campus in the next year, to have not just a lack of medical services, but medical services that are below the standard of care at Stanford Hospital. I again affirm what Professor Dauber said and urge the committee to stop the pilot program at Stanford Hospital so that when students do come forward after being sexually assaulted, they receive the medical care they need and not further traumatization. Thank you.
Next speaker is Blair B. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you. Blair Beekman here. To be clear, during the initial public comment, I spoke on the eviction moratorium issues and how that can relate to health. And then I spoke on VTA issues also. For this item, I'm interested how, there's been, I think it's a county level domestic violence task force group that's been going on, and they're supposed to be having some sort of a specific subcommittee process. I think Supervisor Chavez is leading it, and it'll be in July or August. They were going, they're addressing a whole bunch of domestic violence issues at this time. I think I needed to comment that, for all the good ideas that you're coming up with, there isn't a real good sense of there's supposed to be a future developing of a police peer review program that they're trying to initiate through San Jose through the domestic violence issues. But yet they're not really incorporating that. They're using all the other functions of using the SEIU and hospital services ideas as part of the peer review program itself, but not engaging police officers to directly address themselves about the domestic violence issues. And there's a whole peer review program directly for police officers that I think needs to be addressed. This could be issues for Supervisor Ellenberg and the work that she's doing at this time. And, you know, this is a really important issue, what you're talking about here on this item, and it'll be included in the domestic violence, you know, committee process of Supervisor Chavez. I hope you can really address the police peer review program, what they can do between themselves. I think that's a real growth potential of mental health and openness that can really be helpful. Thank you.
Next speaker is Maya Brockbank. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Maya Brockbank, and I am a recent graduate of Stanford University and a sexual violence prevention advocate. I recently have had survivors come to me after their experience trying to achieve a safe exam at the Stanford Hospital, and all of their experiences directly contradicted everything we just heard from Ms. Kerr, and so it's really, really disheartening to hear that. I raised these concerns with Stanford. We have made reports, and nothing has been done, and in fact, today we were told by the Stanford administration that they were just going to wait to see what the county, you all did to affect this issue, which is really disheartening because it shouldn't have to get this far. But unfortunately, even if there have not been formal complaints given to Ms. Kerr, I have spoken with survivors who were in public spaces given these treatments. They did not call an advocate for a survivor that I spoke to, despite that being federal law, to help them. And there's a variety of issues that are not compliant with the promises that were given. And so it's heartbreaking to hear this exact contradiction being told just because it's easier to not do anything. It's really, really hard to hear this as a survivor myself, and I must agree with Professor Dauber and Ari that the situation at Stanford must be put on pause, but not stop, because I don't want this to be something that's paused so that it's out of sight, out of mind, but pause so that survivors don't go through this traumatizing process, but the errors are resolved as quickly as possible, and the promises that we were given 3 years ago about what this space would look like and what it would deliver are kept. And when those can be made, hopefully as quickly and swiftly as possible, the space should be able to reopen for the large number of survivors, especially on Stanford's campus, and the ones that Ari mentioned are coming in a red zone period to be able to receive the care that they deserve and are entitled to and that we were promised to years ago. This should be a basic healthcare right, and it's really discouraging that it now has to fall to you all and that Stanford itself won't take accountability, but I really urge you all at the county to help and step in however you can. Thank you.
Next speaker is Kirsten Shaw Metler. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you. I am Kirsten Metler. I am a rising junior at Stanford University and co-director for sexual violence prevention. I'd like to reiterate everything that has been said by advocates and Michelle Dauber today. It is really concerning that Stanford and personally, President Tessier Levine made a commitment to creating a space at Stanford for safe exams that was comparable to Valley Medical Center years ago, and still we are yet to see that. This is a health issue, this is a legal issue, and it's just completely unacceptable. Some survivors have come forward and they did not actually receive their exam because the experience was so traumatizing. That has a lot of long-term consequences that are directly the responsibility of the university for having not created the space that they promised. This is unacceptable, and it is really disheartening that the university is refusing to own up to these mistakes. It endangers the large groups of students who will be soon coming to campus, and it endangers the community. I really hope that this committee can take action quickly. Stanford cannot continue being a location for safe exams as long as it refuses to actually create a private space with a private waiting room, private shower, private restrooms, private exam room for survivors. So until that is done, there needs to be a pause on the Stanford site because it is truly unacceptable and it is doing more harm than good for the survivors in their time of most need. Thank you, and I yield the rest of my time.
Next speaker is Aditi LeMay. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Aditi Lemay, and I'm a sophomore at Stanford. I've been involved in discussions directly with nurse manager Kim Walker, as well as communication with Professor Michelle Dauber. And here is my short and sweet take-home message. After these conversations, I no longer feel safe referring survivors, friends, people who come to me with these experiences to the safe site at Stanford Hospital. The problems are numerous. There's a lack of private space, a lack of private trauma room, a lack of private shower, increased trauma to survivors, lack of cleanliness in the examination room, sometimes lack of equipment in the given examination room, and more. Private spaces is the standard of care for any safe exam or any SART exam. Medical services, namely this pilot program at Stanford, exists to serve the community and to also be available and accessible to undergraduate students and students at Stanford, who, as we all know, need access to the service at higher rates than the rest of the population. So the purpose of medical services, again, is to aid survivors, but instead it is in fact causing harm by providing false hope and a sense of trauma to survivors. In an ideal world, Stanford could be a location for safe exams, and we hope that that will be the case in the future. But as of right now, this is not the case. To be clear, this is not a statement on the excellence of the SART examination nurses, who we are so grateful for, but this is a statement on the lack of dedicated space, lack of follow-up on survivors' complaints and trauma by Stanford, and numerous issues that are specific to the structure of the Stanford site. I concur with Professor Dauber, Ari, and Maya and Kristen's prior comment in the hope that you will pause the pilot program site here at Stanford Hospital in order to resolve the problems at the site and to reopen it only when it's safe. Thank you.
The next speaker is Sasha Ryu. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, can you hear me okay?
Oh, yes, go ahead.
Okay, thank you. Perfect. I want to start with a content warning. I will be discussing sexual abuse in my statement. My name is Sasha. I graduated from Los Gatos High School earlier this month. I'm going to USC in the fall. I'm here today to urge the board to temporarily pause the SAFE program at Stanford Hospital. Recently, when a survivor went to Stanford for an exam, they were forced to stay in a non-private waiting room for hours. The whole time they were repeatedly throwing up and crying. After 3 hours, they were told that there was only one nurse who could complete the exam and that the nurse was an hour's drive away. The survivor was so traumatized and discouraged that they left without getting their rape kit. This is not acceptable. I compel you all to put yourselves in these people's shoes. In the aftermath of surviving a violent assault, they can't even take a shower. They have to keep the evidence on their bodies for hours so that they can have a chance to document the proof and bring their assailants to justice. But in the case of the survivor who went to Stanford, they didn't even get to do that. During their greatest time of need, they were dismissed and put further at risk by being forced to wait in a public location. These aren't just tragic anecdotes. These are people's lives. Some of these patients are as young as 12 years old. Please let these exams return to Valley Medical until Stanford leadership makes these basic improvements. It cannot wait. Thank you.
The next speaker is Elena Fox. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Elena Fox. I'm a constituent of this county, and I wholeheartedly concur with Professor Dauber and the advocates who have spoken today. I want to begin by emphasizing that this discussion absolutely is about quality. Rape victims already suffer extreme pain, humiliation, and long-lasting trauma. When they go to get help and go through the rape kit process, they should not have to endure more of the same. The conditions at Stanford for victims entail unreasonable wait periods, lack of privacy and security, no designated areas dedicated to being spaces for the exams, blatant disregard for the mental and emotional well-beings of survivors, and zero consideration of trauma-informed language, to list just a few. This is unacceptable. Already, so many people do not go to hospitals to have rape kits conducted because of quite a number of valid concerns. When we allow conditions like Stanford's, we add to that list of concerns and create significant problems on the individual and community level. Beyond the obvious horrific consequences for the survivors themselves, when we make it harder and more traumatizing to get rape kits, we further interfere with the already highly problematic legal side of the matter, which has the potential to prevent prosecution, allowing for perpetrators to continue their behavior. Expanding services is wonderful and important, but only if we expand those services while maintaining quality. It helps nobody to offer services at more locations that end up causing more harm than good. As other speakers have said, this is not to ask you to stop because this is an important issue, but to put a pause until we can ensure that this quality is truly helping victims. For that reason, I respectfully urge you to put a pause on Stanford's Safe Pilot program right now until these matters are fully and thoroughly addressed. Thank you.
Our next speaker is Wesley Mukiyama. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking. Wes, are you there? I will come back to Wes.
Here, can you hear me?
Go ahead.
I just have a question in terms of outreach to ethnic groups. I know this is a very shameful situation for a lot of ethnic communities who even don't speak the language, and I'm wondering what the program does to reach out to those communities. And given the fact that Asian girls from 15 to 24 have the highest rate of suicide, I'm wondering how you're addressing this problem and reaching out to these communities. Thank you.
Next speaker is Alexa Kapoor. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Alexa Cooper, and I'm an incoming freshman at Stanford University. As I near the beginning of my first year of college, instead of the normal nerves and excitement my peers are experiencing, I fear for the subpar conditions I may be forced to endure upon the chance occurrence of sexual assault on campus. Guaranteed private waiting rooms, sterile and pre-designated exam rooms, and thorough collection of evidence are all baseline asks, especially at a university with a known history of sexual harassment. Asks to which Stanford and its corresponding SAFE program have failed to answer, despite President Tessier-Levine's knowledge of survivors who have undergone re-traumatizing experiences at SAFE. Like the many others that have spoken before me, I urge you to temporarily pause the SAFE pilot program at Stanford and return this service to Valley Medical until these problems can be addressed and remedied. Thank you.
That concludes our request to speak.
Forgive me. Thank you very much. And again, if I flicker on and off the screen, it's only because I've got a challenge here with the bandwidth and the internet connection. Thank you to all of you who spoke today. I know these can be very hard conversations. Thank you for being focused on the patient's perspective and the survivor's experience in particular. I think, Ms. Walker, I'll go back to you if I may, but certainly invite Ms. Berlini or Mr. Lorenz to lean in if at any point they feel like they can help guide the conversation or share useful information. As we discuss how we can make some progress today, I guess the first thing I would ask is, should we, if we're looking at 3 sites, which was the original direction in the referral that I brought to our board, should we in fact be looking at 4 sites, including the site in Santa Cruz County? Just because if so, we ought to sort of get that squared away right off the bat.
With respect to Santa Cruz County, we haven't had any issues at all. We have a dedicated space and an area of privacy separate from the exam room.
Well, I'm prepared to accept that as an answer, Ms. Walker. I only asked because, as you know, I've also asked about the VMC site, using this as an opportunity to sort of do a reassessment and just check in yet again to make sure that we're doing what we need to do the way we need to do it. And then, of course, the site in progress for South County. But I'll look to you or Ms. Berlini or Mr. Lorenz to lean in. It sounds like you're comfortable with focusing on our 3 Santa Cruz County sites, our 3 Santa Clara County sites going forward, yes?
Yes.
All right, and I see some head nodding there as well. Thank you. That being said, I guess the question I would ask as our county has to make a decision is, Mr. Lorenz, who actually makes the decision about whether or not we quote, take a pause or suspend operations in a particular venue? I am asking in part just as so that we all understand what the process is, but also in the absence of a full Board of Supervisors meeting until, which is not yet scheduled until mid-August, I'm trying to think clearly here about what can be done with some sense of urgency. So is a decision to suspend or pause, if it's to be made by you and your shop, absent direction from the board or the county executive?
Thank you, Supervisor Simitian. So first and foremost, from a program standpoint relative to the clinical care and the quality of care that's provided, the clinical team would make a recommendation to leadership within the health system and ultimately to the county executive office to suspend services if we believe that patients were at risk or the services were not up to standard.
And that clinical team presumably includes Ms. Walker and Ms. Berlini, yes?
Yes, it does, as well as the medical director.
Okay. I guess the next question I would ask is, are there some things, the concern that I think we all share is that if there's work to be done, that it be done again with some sense of urgency and in a way that does not either put anyone at risk or compromise the criminal justice system or provide a less than best practices experience for a patient survivor. Are there things, so I want, with that in mind, forgive the long preface, but I want to ask, are there things, and maybe this goes to Ms. Walker and Ms. Berlini as the clinicians, are there things that, I don't know whether it's 2, 3, 4 things that the hospital could do differently right away that would have some meaningful impact on the patient experience? I mean, I know some of these things are all too easily lost in the process and the bureaucracy, but it strikes me there must be things, as I look at the long list of individual concerns that have been raised, there must be some of these things that could simply be done basically upon request if the hospital was amenable, yes?
Yes. I think one of the first things we could do is, start with screening processes. So when the patient arrives, making sure that we can keep a patient who has disclosed sexual assault or strangulation in a space that is protected, private, confidential, trauma responsive, and then look at getting them connected with the SAFE program immediately before they would sit for hours in a space and maybe not have disclosed. Provide more instruction on how to access services so that when they arrive, they know exactly what to say or what to do, who to ask for, because they're not going to have this instruction previous to this. We need guidance from those that are present. So screening instruction, a workflow that is different and meets all of the issues that have been brought up. That would be my first recommendation. As to the space, I can't speak to that. That would be a discussion that would have to happen with Stanford, and we can see where in the workflows we can optimize space and exam requirements, things like that. Right now, the exam components, as I described earlier, all take place without any deficit, but to the point of all of the speakers, the patient experience is of utmost importance. So that is something that we need to talk about. If we can't mitigate those issues, then we would need to talk about the potential of pausing the program. I worry about the patients because we've done so much community outreach and the instruction and the information that's out there that now there'd be patients arriving at Stanford. I would also want to make sure that if they arrived there and they found out there was in fact no program because it was paused, that there was a fast track to Valley so that they didn't have to wait, or as previously mentioned, be transported in the back of a police car or spend money on taxis, things like that, that are huge barriers and certainly would add to their trauma load. So I think there's opportunity, to your point, to rapidly respond and see what we can do to optimize it now, and then come back and talk about options if that doesn't work.
Well, I'm going to ask you and Ms. Berlini and Mr. Lorenz, whoever wants to lean in, and if it's all three of you, that's fine. Is it your recommendation, your best professional judgment, that we should take a pause now, or we should try and take some steps to improve the patient experience, the survivor experience, with some of these immediate steps before reaching that decision?
Given the amount of work that has gone into making sure that we have response location and depth to that response and the setup and everything that is present at Stanford, to undo that would take some time. And I think it would be less impactful to the patients arriving if we can stay there and work on the issues that have been brought up rather than pausing right now and what's currently available there.
Ms. Berlini, I'm looking at you. Want to make sure we hear your view on this same question, which is sort of a threshold question, really, in terms of addressing the issues that have been brought to us.
Thank you, Supervisor. I appreciate the opportunity to speak to it. I would agree and echo what Kim has said in regards to pausing the program. She and I are both very confident in the quality and the integrity of the medical forensics exams that are occurring at Stanford. The quality of those exams are certainly equivalent to those that are being conducted at Valley Medical Center. If we had such concerns about the integrity, we certainly would have raised those. But having said that, there's a heaviness today from hearing the public comments, and we very much value and appreciate the feedback that we've received from the speakers today and our patients. We are committed to working with Stanford and look forward to working with Stanford to make any improvements that are necessary to improve the workflows that lead up to the medical legal exams, and we would like the opportunity to do so and give us an opportunity to address some of the immediate concerns and then come back if we find out that we need additional assistance or we feel we need to pause at that time.
Mr. Lorenz, I want to, you're at the top of that pyramid. I want to make sure I hear from you that your views are heard here. What's your take?
Supervisor, as Andrea has mentioned, the public comment, the concerns coming forth from the victims or individuals that have been assaulted are not only heavy, but whether they're direct or indirect, we have an obligation to follow up to make sure that the concerns around the experience at Stanford are addressed. And from a timing perspective, I would imagine, given the comments made by Stanford, that they're willing to come to the table immediately and work with us to resolve those. And obviously, I can't speak for Stanford, but they've been at the table, and we're just going to have to hold them, and everyone to that for the benefit and for the importance of everything we've talked about. So, I would agree with Ms. Walker and Ms. Berlini that instead of unwinding something, let's take a step forward and try to resolve these issues as quickly as possible.
Yeah, I think Ms. Lorenz and Ms. Berlini and Ms. Walker, and I know you share this concern. The anxiety here is that this that these issues get addressed again with some urgency, and that this not turn into an extended series of conversations while survivors are still in need of these services. And so I'm sitting here in real time trying to think through with you all how we can make that happen. Let me ask Ms. Walker, Ms. Berlini, and Mr. Lorenz, as to the Stanford site in particular, if you could work immediately with folks there at that hospital, but we have Health and Hospital Committee meetings, this committee scheduled for August, September, October, November, December. Could we get an immediate report back in August on progress made with a recommendation from you at the September meeting about whether about what next steps would look like, or whether you're inclined to recommend or suspension or pause at that time? Is that a timeline that works from your standpoint as the clinicians, to use that phrase again, Mr. Lorenz, Ms. Berlini, and Ms. Walker?
I think that's a reasonable time frame. Obviously, we're going to do things immediately to see if we can, to make sure that we don't lose one patient. So that will be an imperative for us, but I think the time frame is reasonable for moving the needle and making sure that if there are options, we can get those addressed and report back.
And presumably, if at any point you felt that you just had to make the decision to suspend or pause the service, you would make that, as Mr. Lorenz said earlier, as clinicians without direction from the board or this committee, which let me just stop there and let you answer the question. Thank you.
If there was harm to the patient that was continuing, we would want to make sure that we stopped and did the right thing. So we will be looking at all of the comments that were made today and making sure, again, our services are supported and appropriate, and then have those conversations and see what we can do immediately and evaluate what can be done immediately and if that's going to serve the purposes of continuing.
Thank you. Ms. Walker, and I'm going to stop repeating all three names. I'll just say Ms. Walker and others. Would it be possible, in order to make sure that time is not lost or does not drag on, that we get, even though the county board takes a recess in the month of July, that we get an off-agenda report, let's say, on or before the last day of July, that would provide a little more immediacy in terms of the information coming back to our committee and the board. It would make it available because it would be a public document for our full board and members of the public. And then that would mean we weren't waiting 2 months till the August meeting to have at least some feedback. And I also think, quite bluntly, if you have to have something to say by the end of July, there's more likely to be something of significance to say by the end of July. Does that work as well?
Yes, we can do that.
Yeah, that's no problem.
Yes, Supervisor.
And thank you. And we have, I think, forgive me, somewhere on my screen, I think we have Cheryl Soloff from the Harvey Rose organization. Ms. Soloff, are you with us as well? Let me ask again, do we have anyone from our Harvey Rose organization? All right, well, if not, we will ask them to essentially do their best to conduct their audit work in tandem with whatever timeline we ultimately come up with today before the end of this item. Let me ask if Ms. Carr is still with us from the Stanford Hospital. Can the clerk find Ms. Carr? Possibly not.
I think I found her.
Just found me.
There
Yes,
we go.
Supervisor
Thank you.
Committee and I. Yes, I'm
Hi,
here.
Ms. Carr. I wanted to ask, I've laid out a timeline for, sort of check-ins and response and some, frankly, accountability for the system. Is that a timeline that you think you and your colleagues might, well, I'll be a little more direct. Can you and your colleagues commit to working with the team at the county on that timeline?
Yes, sir. We worked with Kim very directly, as well as Andrea. They were with us last week or the week before. Yes, we can. We work very closely together in the development of this program.
All right. And Ms. Carr, I'm just going to say this out loud. These are hard conversations. They're important conversations. I know no one likes to have their work critiqued. I know that it's altogether normal that people will respond defensively under such circumstances. But I want to be a little bit selective and just pluck from the letter you and your colleagues sent the line where you indicate that Stanford Healthcare is dedicated to continuous improvement. And I want to try and frame the effort in that way. Part of the reason that I asked that we look at VMC and the South County effort as well is because I think all of us have an obligation to keep asking ourselves over and over and over again, are we doing the best we can for the patients we serve? Over and over and over again. And there's no such thing as good enough. I want to exhort you to hold fast to that commitment to continuous improvement. And I know that, again, may be difficult when you feel like the organization is in some way being critiqued, but can we ask for that continuous improvement frame of mind going forward?
Absolutely, sir. That's part of our DNA, and happy to work with Kim within that spirit.
All right. Well, I think I don't want to try in the committee today to make judgments or choices about very specific or individual elements of the program. But Ms. Walker and Ms. Berlini, before I go to Dr. Smith, which I will do in a moment, then I want to go to Supervisor Lee. It seems to me you have a very clear set of items now that you can walk through in evaluating whether or not each and every one of these facilities meets best practices expectations, yes?
Yes, definitely.
Yes.
And when you sit down with the folks at Stanford Hospital, that will be essentially the set of metrics that you use to determine whether or not the patient experience, the experience that the survivors have, is as good as it can possibly be under such circumstances. Yes?
Yes.
Every effort, yes.
All right. Then, Dr. Smith, I'm going to come to you, and then I'm going to go to Supervisor Lee. But as I'm sitting here thinking this through, I'm thinking, let's get our staff from the county at work in this very focused way with the folks at Stanford Healthcare with a report back off agenda in 30 days. And again, that's a public document. Then a presentation in August at our board, at our committee meeting. Then in September with essentially a set of formal recommendations, so that's the expectation is that there'll be some clarity around how we're going to proceed. And then again, schedule this item October, November, and then again in December in a more fulsome way to make sure that month after month after month, we're on it to make sure that what needs to get done does get done. That, of course, will be concurrent with the audit that the board has authorized, as well as the review by the Women's Commission and any immediate changes that staff thinks they can implement. Dr. Smith, does that sound appropriate to you? And any other thoughts you want to ask? You've been very patient. Thank you. I appreciate everyone letting me walk through all this.
Yes, Supervisor, I'm supportive of your direction. I just wanted to try for my understanding and maybe the understanding of others who are watching, distinguish the actual exam and collection of evidence and treatment in the treatment protocols from the what I'll call milieu of the hospital setting. What I heard from Professor Dauber and others from Stanford that were expressing their severe and extreme concerns, which sound very, very, very troublesome. They rotate mostly around the facility and the way that patients are treated before they get their exam or after they get their exam. And the SAFE team really is the team that does the exam, but they are called to the facility to do the exam. So they don't have control over what happens before they get there or after they leave. So the only way these efforts really work is if you have a real partnership between the facility and the SAFE team. And I think what you're asking for is a great analysis. I mean, basically, we can certainly take Ms. Kerr up on her efforts to find a better location for the pre-exam and post-exam and better training for their staff, and get back to you with a report. But that's only part of what you recommended. I'm just trying to clarify from my understanding, if the real issue of significant proportion, or I shouldn't say the real issue, the most important issue is the facility location that should be more like VMC. That will require Stanford to move to a different location or move us to a different location, which presumably they could do.
Well, as I said, without trying to sort and solve in this meeting, which is an imperfect venue at best, it does sound repeatedly, Ms. Walker, like this issue of a dedicated space is key to an improved outcome. Am I hearing that right?
I think it could help mitigate a lot of what was spoken to today in the public comment. Patient experience is incredibly important for these survivors.
Ms. Carr, I have the letter again, but if we could ask the clerk to, and now I see Ms. Carr's hand up, so let's go to her and ask, is a dedicated space something that the hospital can and will provide? Let's just ask the question directly. Ms. Carr, go ahead. The clerk will enable that. Thank you, Ms. Carr.
Can you hear me, sir?
Yes, go right ahead. Yes, we can.
So, yeah, so I don't feel capable of speaking on behalf of Stanford Healthcare to commit a separate space. We have an emergency room right now, so I would ask just for some time to speak with our senior leadership. I just can't commit at this moment in time, sir. You know, we've had a lot of discussions with Kim around our space, and we had developed workflows with the space we had. So if you would be so kind as to give me some time, I just can't commit at this moment in time that on behalf of the organization.
I hear what you're saying, and I understand that, but I also want you to walk away from this meeting with a clear understanding of the importance that our professionals attach to a dedicated space, and that I personally attach as one member of the Board of Supervisors to that dedicated space in terms of addressing these issues. Why don't we go to Supervisor Lee and thank him for his patience on this item. Go ahead, Supervisor Lee.
Thank you, Chair Samitian. Yes, the comment certainly was very concerning. And I would ask Ms. Kerr if you could check back with your senior leadership regarding the fixed dedicated space that's been talking about. I think would be very helpful, because apparently this is one of the key issues that's been raised by some of the victims advocates of the issues at hand. And I fully agree with Chair Samitian's approach of trying to ask our own staff to pay the visit over at the site to make sure. And I certainly don't doubt that Stanford is doing its best in terms of meeting these needs, but it does look like that the dedicated spacing is a very important part, which is, as we know, spacing is never easy in any type of decision, especially large organizations. I understand that, but if this is something that could be arranged in the future, I think that would significantly improve the service being rendered and addressing a lot of the concerns has been mentioned today. So I would ask Ms. Kerr if you could get back with us on that. I appreciate it. In addition to the issues just mentioned earlier, I tried to read on the report we provided today regarding some of the survivors survey, and it seems like we do need better outreach of getting information out. The report mentions improvements to the website, which is great. I'm wondering if we can have a bit of a more proactive approach as well, including of having, say, advertising or paid media into or reaching out to community meetings, collaboration with schools, community clinics, and or even law enforcement agencies. That's a question for staff.
Thank you, Supervisor Lee. Yes, all of those things are being looked at and addressed. Some are already in place. The SARC committee, the group of multidisciplinary partners, that is a discussion that we have. One of the tasks in the penal code for this group is to trend sexual assault in the county and our response to it. So we do look for opportunities to improve there. With the rest of it, yes, we are looking at ways, even including what the speaker said. How are we finding the diverse communities? Those are the most at risk, and making sure that they also have this information. To that end, we've been talking with our social media experts, our partners, and getting the website up, looking at how we can best technically get information to people. I've also even asked that maybe we could look at the RAs at the school at Stanford and other universities to see if we can improve their training, so that incoming students have the opportunity to gather that information, have access to it in a time of real need. And the RAs, I think, are perfectly suited to be able to assist with that. But public comment is always welcome. So if there's spaces that we are not in, that they would like us in, we are happy to hear that.
Great. And the survivors survey results, assessing the safe services via the survivor's perspective. Is this something that you could provide to the board, an off-agenda report?
This is something that was actually requested by Supervisor Chavez. So yes, you will actually be getting this very shortly. I just gave you a little early peek at it, but it's going to be presented. It just was completed, but that is one of the things that came out of it, and just brought that forward here for this report. The rest will be coming through CSFC.
Right. I recall there was a discussion of a Harvey Rose audit of the SAFE program. Is it something that we'll be getting at HHC in the future? Do you know any dates when that might be coming forward?
That, I believe, is the request. You're speaking of Supervisor Simidian.
Correct.
That just came forward, so they have not initiated that yet. And I didn't hear if there was a date or a time frame that was included in that, but I know that he did reference that he would like it to align with what we're looking at with Stanford.
Supervisor Lee, we have had enough conversation with the audit folks for me to think that their timeline could be consistent with the timeline that we've talked about a little bit today. I think the greatest challenge with the audit process is that as a matter of standards, they typically provide an opportunity for review and comment by folks whose work they have reviewed. And that adds probably a couple of months, if I remember correctly, to the end of the process. So we'll continue to follow up on that. And I should just indicate no one should think ill of the management audit team. I specifically did ask them to be with us at the board meeting on the 22nd, but I'm not sure that I thought to do that today. So their absence should not be construed in any way as a lack of commitment to the project. We've checked with them both before and after the meeting about that. All right, back to you, Supervisor. Sorry for the interruption.
No, thank you, Supervisor Simidian. That's really all the questions I have. And I think I did see Ms. Kerr has a hands up as well.
All right, let me just check. Let's go back to Ms. Kerr, and I want to wrap it up after this because I do think we need to take some action. Ms. Kerr, further comments, or was that just a lingering hand up that hadn't been taken down yet?
A lingering hand up.
All right, then thank you. I'm going to try and frame this in the context of a motion, which is we already have action by the full board at the meeting on the 22nd of June. So I know that Mr. Lorenz and his team, including Ms. Berlini and Ms. Walker, will be responding to that. Additionally, supplementing that or refining that direction, I think what I'd like to do is offer a motion that provides that this item will be on our agenda for August, September, October, November, and December. That prior to that time, we will ask for a report by the end of July that is an off-agenda report. It's an open public document on progress made, issues raised, status of the consideration. That will look at September and December as what I'll call, sort of key milestones in terms of decision making in the organization. An acknowledgement today that if at any point the clinicians thought there was reason to pause or suspend operations based on their own knowledge and experience professionally, they would do so without the need for board authorization. It's very specific direction to please, working with the folks at Stanford Hospital, take such steps as are immediately feasible and act with some urgency there. and to focus on the issue of a dedicated space as a early and important priority. I think that has covered most of the ground. That covers most of the ground we walked today. Ms. Walker, Ms. Berlini, Mr. Lorenz, did I forget anything? If that's the sort of lengthy motion I want to proffer?
I think you covered everything.
Agreed.
And thank you. And Supervisor Lee, is that a motion you would be prepared
Yes,
to
I'll be
second?
happy to second it.
And Dr. Smith, anything I left out there? I want to really make sure every part of our organization is clear about the expectations going forward.
No, I think that's clearly understood and we'll accomplish it.
All right. Then we'll ask the clerk to call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. And again, my thanks to the team and the folks who provide these services. It's work of inestimable importance. And my thank you to everyone who participated in the conversation today. I know these are hard conversations to have and be part of that. So thank you very much. That concludes that item for today. All right, that takes us to item number 8, which is a report on specialty clinic and pharmacy in Mountain View. And in light of the time, I'm going to try and make this one relatively quick. Mr. Lorenz and Mr. Draper, I'll say thank you for the report. I see a target date for the end of this year for these operations. Am I reading my report correctly, Mr. Draper and Mr. Lorenz?
Yes, you are.
All right. Now, what are the chances we're really going to make that date?
They're good. We're making progress, and I'll leave it at that.
All right. Dr. Smith, I'm going to put you on the spot. Can I get you back on the screen?
Yes, as soon as I get my computer to work.
There you go. Thank you. Thank you for that. You got the county government center right behind you. So Dr. Smith, we've got a report here for this site. This has been a work in progress for a long time, and we've been, I think, in a very good series of conversations with Planned Parenthood about the changing nature of the model and who rents space from whom and who provides what services. Staff is telling us December. I want to put you on the spot if I can in an open public meeting and say, can I get your commitment that come hell or high water, we're going to open the doors by the end of February? That's 2 months more than they've just given us.
We'll open it 2 months before, or yes. Yes.
All right.
And
I'll take yes. I'll take yes for an
depends
answer.
on how high the water is. If the water gets
All right.
to 300 feet, we're in trouble. But presuming that we don't have another natural disaster, yes.
All right. Mr. Draper, Mr. Lorenz, I look forward to December, but come hell or high water, I'm going to be standing in front of that place by the end of February, and we're going to be opening up something, please, okay?
As Dr. Smith said, if hell or high water is not a problem, we'll be there.
All right, thank you very much. Then I'm just going to ask if we can get a motion to receive the report from Supervisor Otto Lee.
So moved.
I will second. I'll ask the clerk if we have any speakers on this item.
There are no we have one request to speak.
All right.
We no longer have a request to speak.
Thank you. Then I'm going to ask you to call the roll.
All right, Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye.
Thank you.
All right. Look forward to it. Thank you. Subsidized medication program update report. Supervisor Lee, I don't want to forestall any questions from you. I did have a chance to talk with staff prior to the meeting because I had some questions. And here's what I want to ask if we can do, which is Mr. Lorenz and Dr. Smith, and I apologize if our pharmacy folks have been waiting through the earlier meeting, but I think what I'd like to do is ask if this can come back in August, but with a clearer focus. I don't want the program to, quote, stop, but I do want us to move forward with a clearer and narrower focus on the cost assistance for folks receiving these 3 life essential medications, insulin, epinephrine, auto-injectors, and asthma inhalers, without tangling them up in the tobacco cessation and obesity programs. And it's not that I don't think those are good and important programs. I do. I just worry that we're getting in the way of our own efforts here, that what would make this. So I'm going to ask you to sort of think about it some more, work it some more, and come back to us in August. Dr. Smith, does that work for you?
Yes, we can refine the program concept better, but continue to move forward as we're doing that.
Okay. And again, I think it's and Mr. Lorenz, at the risk of having the CEO fall out of his chair, I'd be your first vote for additional funding for those other programs if they were standalone programs. But
wait a second.
There you go. So I think you've got, but the more I've thought about it, the more anxious I have been about sort of trying to do too many things in one program. That's really, I think, if we want to be laser focused, we should be laser focused, and I think we're not there. So with that direction, could I get a motion to receive the report, continue to August, and provide that direction from Supervisor Lee? Supervisor Lee, are you with us?
Yes, sorry, I forgot to turn off mute, just talking to myself. And yes,
there you go.
Right. Actually, I do have one quick question. Is
Please.
Regarding the TSS and web design staff is working on this tracking website. I just want to check in to make sure that this website will be in multi-languages. Is that correct?
That is correct, Supervisor Lee.
Great. And also want to talk about in terms of the outreach, do you plan on doing type of media outreach through, say, radio or even direct mail on the program?
We will be putting together an entire outreach and marketing campaign to inform the community throughout the county.
Great, thank you very much. And that's all the question I have, Chair Smitty.
Motion to approve the direction as indicated by the chair.
And second.
And we will check with the clerk, see if we have any speakers on this item.
We do have one request to speak.
Please.
All right, the next speaker is Blair B. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. To speak to how the pharmacy items of the last item and the medicine adherence of this item, if they can possibly relate to the SAFE project of the 2 items back. I think it's important that as you're addressing the SAFE program for this fall and next February, is there ways that you can work on some issues now in the upcoming months and to do some kind of as you'll have official reports by this fall, can you do just some basic work, cleanup work? I don't know if cleanup is the right word, but just preliminary work in the coming months to just checkups, a little bit of a overview, oversight in some way, just to make sure everybody's trying their best, and then we can have official reports by this fall. Thank you.
That concludes our request to speak.
Thank you. Thank you very much. Then I think we have a motion on the floor and we will call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. Motion carries 2-0. That takes us. Thank you all, folks. And I see Nari there. Sorry to keep you waiting so long for what was a brief report, as it turns out. Thank you. That takes us to item number 10, which is the Adult Custody Health Services Report. And is it Dr. Day who's going to be presenting on this?
That's correct.
Dr. Day, let me ask for your help here. We have the challenge of a hard stop at 5, I'm afraid. We could, I think what I'd like to do is just, I'll stop talking, ask you for a brief report, but if you think that we need to continue the item after you just give us a brief report, we can revisit this if you have a more fulsome effort that you think it's important we hear sometime in August.
Sure. And thank you for that, Chair Samiti. And I'll just keep this brief. You do have the written report.
We do.
So you can read through that. The programs that I wanted to talk about was the trauma-informed care. We also do what's called the EMDR, which is eye movement desensitization and reprocessing. We do have certified clinicians that are providing that around trauma. Another program that we're looking at, and I think I have presented on this back in September of 2020. This is just an update of our No Warriors Left Behind Patriot program. We're continuing with that program, and we do have clinicians that are licensed clinicians that are veterans and have a keen understanding of the appreciation and the lived experiences of our incarcerated veterans. And so we've had good successes with those patients being very disciplined in their programming, participating at high levels, and also participating in the Department 61 Veterans Court. A new pilot that we're looking at, and I'll make this brief too, is called the LACE Index, and this is an evidence-based predictive model to help mitigate hospital readmission rates by identifying patients who are more likely to be readmitted within 30 days. This is an industry standard, as you may know, about readmission rates, and it is an indicator of quality of care. And so we're instituting this LACE program where it has 4 parameters. It takes the length of stay, it takes the acuity of the admission, comorbidities, and then the number of emergency visits in the previous 6 months. And what that looks at is if the patient is being readmitted for the same diagnosis within that 30-day period. And we are putting some very specific case management and care management tools around that. The MAP program I've talked about before, so I won't spend a lot of time on that, other than to let everyone know that all of our physicians now, they all have the waiver approval, which is required by the Drug Enforcement Agency, the DEA. And so all of our physicians have that waiver where they've had to go through the appropriate trainings, either courses of 8 hours for up to 25 patients and 16 hours of additional training for patients over 30. We do have one paper that is under peer review right now for publication. And we also have an IRB project currently being considered. And so I'm pretty pleased with that. One thing I will talk about this that we're looking as we continue with the MAP program, part of the restructure plan, we do have a dedicated social worker that is now assigned to the MAT program, the MAT program. And that person will be also doing quite a few group therapies around substance use disorder. One thing that we're finding is that we're going to take a look at, especially under the Whole Person Care Patient-Centered Health Home, is that we did find that we do have a disparity in our participants and a health disparity around some of the demographics. And largely the patients that are participated in this program are disproportionately white males. And so we're going to look at that and see if there's something that is precluding other patients to include African-American patients or of African-American descent of participating in that program. I do want to give just a brief update on the restructure plan. As you know, we have started the restructure plan. And so we are well in process in getting positions on board. We are working with ESA. We have a weekly meeting that we set up called the Employee Services Agency and Custody Health Recruitment Transformation Partnership, where we're looking at some of the peculiarities of getting some staff on board. As you know, this is a niche population. And so although we have vacancies and we're flying these positions, we do have a hard time getting lists of candidates that can sit for interview. We also have scrubbed all of our lists, looked at all vacancies, and now all departments have been directed to fill their vacancies. We have started to begin the whole person care model working with Valley Medical Center. We've had some team meetings with Valley to look at some of the tools that they're using, and perhaps rather than recreate the wheel, maybe just tailor some of their tools under the whole person care for custody health services. We've begun an employee engagement wellness program that we're rolling out during this time. We're developing communication strategies with some of our partners, Josh Berkowitz and his team. And we've also started just recently a professional practice committee, and this is with all of our nursing staff, and it's an advisory committee for nurses to the leadership. And so we're meeting up to 90 minutes a month. And part of that, we have a subcommittee that will also be working with looking at vacancies and hiring in real time. So that's just a very brief overview of what we've done in the last month or two.
Thank you. That was a very speedy but thorough review. So much appreciated. I have no questions, and we did have the report, and I know it's a small thing, but the fact that it was laid out with the nice, crisp 1, 2, 3, 4, 5 Roman numerals meant I could find the information and sort of segment it very orderly way, just as you've just done. Let me see if Supervisor Lee has questions or comments.
Yes, thank you, Chair Simitian, and thank you, Dr. Day, for the comprehensive report. I've learned a lot from the very exciting programs you have mentioned, and I do have some follow-up questions. My first question is regarding the No Warrior Left Behind Patriot program. You mentioned in the report in 2021, there were a total of 21 veterans that participated in the program. Are there any other veterans that have not participated in the program that you know of that is in custody?
We do have, this is a voluntary, and so we do have some veterans that may opt not to participate in the program, but it is a voluntary program. We try to identify those patients by intake if they've had any military experience, but it is a voluntary program.
Do you have any idea how many veterans we have in total in custody?
No, I would have to get that number. I can probably get that number for you, Supervisor.
Great, yeah, that would be very helpful.
Sure.
And being veterans myself, I have to confess, I do have a specific, care of this group to make sure that they are getting the need, especially the fact that we know VA does have a lot of very well-funded program that could also coordinate with it. So we certainly don't want to leave any stone unturned to make sure the services are provided to them.
Absolutely. And we do work with the VA as well with this program.
Exactly. Now, the MAT program, the Medication Assisted Therapy program.
Yes.
Can you provide us maybe in next meeting regarding the revenue expenditures for this program? And how much do you think it would cost to sustain or potentially even expand this program?
Absolutely, we can do that. And as you may know, it initially started under grant.
Right.
And so we're expanding that too. We have another grant that's going out, but we can't get to most likely it's just most of the medication cost. And so we can get that for you.
Right. I mean, it seems like a really exciting program. I believe there is some type of research white paper on this program, and it's something that you could just send us a copy of the paper. I think would be good background information for us to learn how this works. So I really appreciate that. You could provide that as well. So regarding the high-risk opioid users, right, with connections to other at-risk people in the community, I would like to find out how those in the community are engaging and impact that this approach is having in our ability to reduce the usage in our community.
So I know that upon discharge with these particular patients, our physicians are reaching out. They have a pretty well dialed in community resource base that they contact as these patients are going out, and they do work pretty directly. We have a program working pretty directly with the reentry center. And so a lot of these patients will go over there and they'll also be seen with the mobile unit. And so I can get more information on that for you.
Okay, great. My final question is regarding the our in custody inmates seeking the help on behavioral health services, such as like therapy or counseling. Would you be able to provide to us, not maybe right now, if you have the information, that's great. What is the approximate turnaround time when these requests are being made so that they actually might be able to see somebody?
That starts in admission. And so depending on when they come in, we have an intake process that is very detailed and very comprehensive. And part of that is a tier 1 and a tier 2. And at tier 1, there's specific questions around behavioral health, suicidality, those type of things. And so if they answer yes to that, they're being seen within 4 hours. And so we have clinicians that are assigned to the booking area where the patients come in. And we also have a psychiatrist that's there. And so
Right.
depending on what that need is, if it's urgent or not, they have within 4 hours to see those patients. So they start pretty immediately.
So admissions, you have that, but like say after they've been in the system for a while, if they want to request the services, what's the process on that?
If they want to request services, we have, the white card process, which is a referral process to be seen.
Right.
And then based on that, we need to be able to triage those within 12 hours and pretty much get the patient either referred within 24 to be seen.
Okay, great. Thank you very much.
Absolutely.
And that's all the question I have, Chair Simitian.
Thank you very much.
Thank you.
Can we get a motion to receive the report, Supervisor Lee?
Yes, so moved.
And I will second. Let me check with the clerk to see if we have speakers on this item.
Yes, we do have a request to speak.
And I'm going to ask that we go to 1 minute going forward, if that's agreeable with my colleague, just because I'm looking at how close we are to 5 o'clock. Thank you. All right, 1 minute for speakers on this and subsequent issues. Please go right ahead.
All right, the next speaker is Blair B. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, thank you, Blair Beekman. It was my intention to keep my comment short on this item. I just simply wanted to offer, I don't want to be stepping on your toes at all and speaking to things you're already possibly doing with projects. I simply felt that to voice my feelings about projects openly, it can help provide a bit of clarity and just make things nice. and as a way to help the situation. Thank you.
And that concludes our request to speak.
Thank you for that. Call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simitian.
Aye.
Thank you.
Thank you very much.
Thank you.
That completes item 10. Thank you again, Dr. Day. That completes item 10, takes us to item number 11. This is the alcove item. Appreciate the report from Ms. Farrow. And what I would say is, first, thank you. And second, I would say thank you. And then because it's me, I will say, how about those hiring needs that are still outstanding? What would you like us to know, Ms. Farrow?
Good afternoon, Chair Simitian and Supervisor Lee. Thank you. Again, we're just really excited that we were able to open both alcove sites last Friday, June 25th. And since then, we were actually at the alcove Palo Alto site on Monday and had several walk-ins. So services are being delivered and youth are in fact coming forward to accept those services. We are continuing to ensure that all positions are hired. And I'll turn it to Zelia Friacosta, our Children, Youth, and Family Director, who can provide a brief update on that.
Thank you.
Thank you.
Good afternoon, Supervisor Simitian and Supervisor Lee. Yes, we have opened on Friday, and I am actually here today. We have a flurry of activity going on. I'm here with the youth, so it's great to see all the stuff that's happening here. For the outstanding positions, we are actively recruiting for the HSRs, which are the clerical positions. However, we do have coverage. And so we have a position both here at Alcove and also Alcove Palo Alto and also at the Alcove San Jose. We have our psychologist who will be starting in September. But we also were able to provide coverage for psychology through our partners with Santa Clara Valley Medical Center. And so they will be providing psychology consultation until we're able to onboard the psychologist who was hired to be on site. And I think those were the outstanding positions.
Thank you for that. Ms. Terrell and Ms. Costa, could I ask on behalf of the committee that you provide us with a off-agenda memo at the end of the month, just letting us know what the progress has been made on these hiring efforts. That way we won't have to wait 2 months until our next committee meeting. Would that be it's literally a single sheet of paper. I'm really not looking to make work for you.
Sure,
Absolutely.
we can do that, Supervisor Simitian.
Thank you both. And again, I want to say thank you not once, but twice. As I said, on Friday, it was, it would be a great day when you can celebrate the opening of one alcove. If you can celebrate 2 alcoves in the same day, it's really a remarkable day. And Mr. Rao, I know when I made passing reference to the fact that I had been haranguing your staff for the last many months, there was raucous laughter from those assembled in the room. So thank you for your good humor about it. But this is important work that everyone has done, and I hope it is a source of satisfaction for a great many years to come. Supervisor Lee, anything on this item? If not, we'll simply ask Supervisor Lee if he would unmute himself and make a motion to receive the report and direct staff to come back with a off-agenda report at the end of the month.
Yes, thank you. I too have a couple of questions. So I just want to say first and foremost, I would like to congratulate our Behavioral Health Services Department, Stanford Center for Youth Mental Health and Wellbeing, the Alum Rock Counseling Center, and the amazing youth from the youth advisory groups, and all other participating agencies on opening the alcove centers in San Jose and Palo Alto. And I want to congratulate my chair, Samidian, for his oversight and interest in making sure this happens on time. I know this project has been underway for a number of years. I would like to take a moment to acknowledge the hard work and dedication it took for everyone to get these alcove centers up and running. I would like to also get a tour of both facilities at some point in the future to see the fruits of this labor and dedication to serve youth and young adults in our county. With that said, I do have one question regarding the substance use services. So clearly there's been an increased need for substance use services and support among the youth and young adults, which can be partially attributed to the COVID-19 pandemic as well. Would there be any substance use services at these two alcove sites, please?
Yes, so our clinicians will be what we call integrated. They will be providing integrated care. So they will be providing both mental health and substance use services for access and also early intervention. So they'll be able to provide what we call the ASAM level of care 0.5, which includes screening, assessment, and early intervention.
Great. Thank you very much for that. And that's all the questions I have. Chair Samidian, I'm ready to vote.
All right, we have a motion by Lee and a second by Samidian to receive the report. Just second to direct staff to return back with a report. Let me just confirm with the clerk, we have no one in the queue to speak on this item.
There are no requests to speak.
All those in favor, we'll let you do the roll call. Colin, forgive me.
Vice Chairperson Lee.
Aye.
And Chairperson Samidian.
Aye. Thank you very much. And again, thank you to the whole team. I hope you took a whole day to celebrate before we got back to the next challenge in front of us. Much appreciated.
Thank you.
Thank you.
All right, then that takes us to, would have taken us to item 12, but that item has been received as a consent calendar item today. And then that takes us to item 14, which is the programs to support cancer patients. And I think we're going to go there next. And so let me look to Mr. Lorenz to give us an update.
Thank you, Chair Samidian. Again, Paul Lorenz, CEO for Valley Medical Center. As you well know, we awarded a grant to both the Cancer Care Point program, as well as to the Pink Ribbon Girls organization. And both services, I have to say, have been providing invaluable services to our clients and patients within our cancer programs at Valley Medical Center. And obviously, I think, as we all know, their services go beyond the clients and patients we serve at Valley Medical Center. The services range from food support, transportation, and of course, the WIC bank. In our recent review of the status of the program, and we have joining us, of course, Don Ho, the Executive Director for Cancer Care Point, and Heather with Pink Girls with us today. And what I would share with you is that with regards to Cancer Care Point, they are on target to meet their metrics relative to the grant in service to our clients. Pink Girls, we are working with and have amended and adapted to our workflows to increase the referrals of patients and services offered. We will possibly be returning to make some minor adjustments to that grant. And I have to say, in regards to that, it really is about the number of individuals that we're serving the program and not the scope and depth of the services being offered. In other words, our clientele, our patients, if you will, in terms of the number of meals and transportation needed per individual served is much higher than I think we had anticipated. And so with that being said, some minor adjustments to the program, and I think they'll be able to continue to serve our patients as they have done so to a great degree.
All right, thank you. Do we have both of these folks handy to share any comments they would like? I'd like to pull them in independent of our general public comments. So both representatives from Cancer Care Point and or the Pink Ribbon Group. There's Heather Salazar and Don Hogue. All right, let's see if we can, as Ms. Hogue, to just weigh in and just very briefly, please, anything you want to add to Mr. Lorenz's report, make sure we know.
No, I think as Mr. Lorenz said, we've really increased the number of clients that we're serving with the direct referral process, and see that we will absolutely meet the number of clients we wanted to serve, and as I said the other day, likely exceed that dramatically. So I think it's going very well. Thank you.
Thank you. And from Pink Ribbon Group?
Yeah, thank you so much. Like I said, when we met privately, we are very honored to be able to serve these clients, and the stories we've heard have been, tragic and hard to hear at times, but they are so incredibly grateful to have rides to treatment and to be able to get to radiation and chemotherapy consistently. The fact that their kids in the summer didn't have school meals, et cetera, and we've been feeding them and giving them a few extra meals, it's just been a great benefit. And like I shared with Mr. Lorenz and Supervisor Simitian, the stories have touched our hearts and just really changed the trajectory of PRG as we continue to grow.
Thank you for that. And Supervisor Lee, I know from working with you that we're going to get to Darcy Green and her organization in a minute because they're part of this effort as well. But I just want to say to both the PRG folks, Pink Ribbon Group, and the folks at Cancer Care Point, Mr. Lorenz, when I first came on the Health and Hospital Committee, we talked a lot about whole person care. And I know that whole person care, of course, is a medical term of art, and it has a real meaning within the healthcare world. But, to my way of thinking, what the Pink Ribbon Group and the Cancer Care Point folks do really is the ultimate manifestation of whole person care. It is, for folks who are going through this very challenging time in their lives and their medical experience, something as basic and essential as meals, transportation, the wig bank, all of these things are, to my way of thinking, what makes the phrase whole person care real and tangible. So I'm just going to say thank you and pivot over. And thank you as well. When we had this conversation 6 months ago or however many months ago was at the committee, we had some challenges, frankly. And I just think everybody sort of rolled up their sleeves and said, let's get things where we want them. And if we work in goodwill, we can get that done. And everybody did. So thank you again for that. Supervisor Lee, comments or questions from your end? And I know you've got someone you want to pull into the conversation who we want to hear from. So go to it.
Yeah, thank you. So looking at the report, seems like food is the biggest need with Pink Ribbon Group. Are the other organizations like Cancer Care Point or Latinos Contra Cancer, are you seeing the same thing about the food needs?
It's definitely one of the needs. We're seeing kind of recently a lot of varied needs beyond food, but that is definitely one that comes up frequently.
Mm-hmm.
Supervisor Lee, thank you very much for inviting me to be here. Latinos Contra Cancer, we've had a contract we're very proud of with the county for the past 12 years, funded a little bit differently in the last year. The clients we serve are primarily Latino, very, very low income, almost 100% are from VMC, and we are seeing an increase in the need for food, one, to be able to get food that meets the care plan that they receive from their physicians, and two, just food for the household in general. We're also seeing, and you all are seeing this around the county, since last year, last March, our organization has pivoted to meet housing needs. We're seeing cancer patients, particularly those at VMC, struggle to, and honestly, low-income Latino cancer patients everywhere struggle to stay housed. particularly in a time when cancer would have already made it difficult for them to meet these essential needs because of income loss and other things they might be facing. If the whole household has experienced a drop in income loss or a drop in hours, that could make housing difficult. So we're seeing food, housing, and still a need for essential bills, in addition to some medical bill needs. And for many of the clients we serve who may be undocumented or may not have all the documents available to them, some of these smaller foundation dollars that might be available, $100, $500, with a lot of strings attached, can be difficult for them to access. So there's a need for just cash assistance that gets directly into the hands of the medically vulnerable, particularly cancer patients.
Right, and the cash, are those given out like in the gift cards?
We've been doing cash assistance because of this pivot we made last year and the need we were seeing, we became partners within the homelessness prevention system. We were just seeing that many medically vulnerable needing assistance. So they're getting assistance in the form of checks. Last year it was gift cards. It was about $170,000 we gave out in gift cards last year. This year it's been checks.
Great. And the last question I have is regarding outreach. I know there are classes like Cancer Care Point talks about this in Spanish. What other language outreach were you able to do in your organization?
Is this for me?
Yes.
Okay, hi.
Yes.
I wasn't sure if it was for
Sorry.
We have translated two things. We had one of the Valley Medical patients do our mission moment for our national board, and they just talked about the great care they're receiving there and how these services have helped. And so that was a really great thing for our national board to hear. And secondly, in all the patients that we've done so far, we've translated the patient verification form in 16 different languages for your patients. And we use a service called Translate to help get them set up, and specifically with their Uber rides, et cetera, because that was a challenge at first, not to get them there, to get them back, because we had to figure out how to call the office. So we've worked with Uber Health as well as Translate.
Great, thank you.
And I should mention, Supervisor Lee, for the grant that I sponsored as part of the inventory process a year ago, and I'm just going to be very direct with Ms. Salazar here from Pink Ribbon Group. One of the initial concerns that was raised was that in other jurisdictions, their population is perhaps a little more middle income and doesn't have the same level of need that our patients and clients do here. And I was very, and is not frankly always as diverse. And so I was very direct with her and the organization about the expectation that if we were going to try and launch their organization here and see if their good work could take place in Santa Clara County, that they would have to sort of step up on serving a new patient population. And again, my thanks to them for the commitment to do it, and more importantly, the follow through and actually doing it. All right. Thank you. Let me see. Do we have any other speakers on this item today?
There are no requests to speak.
All right, then can we just get a motion to receive the report from Supervisor Otto Lee?
So moved.
And I will second it. And I'm pretty sure the maker will allow me to incorporate thanks to all three organizations and their good people who work there. And I see a nodding head. So with that, we'll call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. Thank you again for all the good work. It's a small miracle and then some. So thank you. Take care. All right, that takes us back to item 13, which is a challenge because there are 8 different subtopics there, but I'm hoping that we can ask folks to either pass if they can pass, or to simply say the single most important thing I need to tell you this month is. So I know it's a tough month when Renee Santiago is without a tie. So I'll go to you first, sir, and say, what would you like us to know under item 13A?
Yes, and thank you. Good afternoon, Mr. Chair Simidian and Supervisor Lee. If you don't mind, since you already heard from departments on the very specific issues that are priority for you, we could go directly into the federal update, which I know this is something that you look forward to at every HHC, given the time constraints. I've submitted a written report for you and all the legislative updates, but I know you also appreciate hearing directly from Burma Gold.
That's gracious and helpful, and thank you for that. And you're absolutely right. Let me just make sure, Supervisor Lee, will that work for you given the constraints of the day? Thumbs up. All right. Mr. Margolin, no pressure, but you are not only the closing content, you are the only content now under item 13. So what should we know about situation at the federal level in terms of health policy and budget landscape?
So I'll be very brief. The first point I would make is that in the infrastructure battle, the hard infrastructure bipartisan piece doesn't contain anything of relevance to health. Whatever happens on health is going to occur in the reconciliation, 51 vote, the human infrastructure piece. The Biden administration has as its main proposal the permanent extension of these ACA subsidies. They're in place now for 2 years. They want to make it permanent. The progressives, led by Senator Sanders, who chaired the Budget Committee, are trying to add other health pieces to this, and the main health pieces are lowering Medicare eligibility from 65 to 60, putting in several $100 billion in dental and hearing services under Medicare, and also doing a pharmaceutical drug purchasing reform piece that we've talked about on many occasions in the past. There's no public option in this package. And then again, no time for a longer discussion, obviously, but reporting back to the committee on an earlier question about the status of public option. It's not part of the federal negotiation. It exists in 3 states, Washington State, where it's operational. It was passed earlier this year in 2 others, Nevada and Colorado, not implemented yet. Washington State has its challenges, but it's operating there. And Hawaii, where we discussed last time, possible public option, they actually don't have public option. They have lots of other things that make them one of the best states in the nation in terms of their low uninsurance rate, but they don't have a public option per se. There were a series of bills that Supervisor Lee asked about. There's an agenda attachment that summarizes their status. If there are any questions, Supervisor, that you have about any of those bills, I'm happy to respond. And that's my abbreviated report.
Well, that was the lightning round if ever we had it. Thank you. I have just one quick question before I go to Supervisor Lee, and that is, you mentioned, Mr. Margolin, that the infrastructure bill was not targeted at healthcare, really. Does that include physical infrastructure for healthcare as well, meaning hospital buildings, as an example, that are not part of the mix?
That's correct. Senator Sanders has $25 billion proposal in his developing package for hospital infrastructure, but it's not part of the bipartisan deal.
All right, thank you for that. Supervisor Lee? Any comments or questions?
No further question on this one. Thank you.
All right, do you want to offer a motion to accept the report? I believe we have 1 speaker waiting in the wings.
Yes, so moved.
All right, motion to receive the report. I will second. We'll go to the clerk and see if we have 1 speaker waiting in the wings. Yes?
That's correct. The next speaker is Blair B. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Blair, are you there? Going once? Twice? All right, there we go.
Blair's here. Blair's here. Can you hear me?
Go ahead.
Hi. My Zoom's having trouble. Sorry. This is the old federal task force committee agenda things. It's interesting you've combined it with health and human services. I don't know how well that will work, but good luck in the efforts. I hope there can be a good future for the federal task force, and it can be a bit more informational than it used to in the past. It's an interesting idea for a group, I think. Thank you for the information, the work of Hawaii right now. It's good to learn that. I know that for Medicare for All, ideas. There are going to be some committee meetings at the federal level this fall to try to review Medicare for all practices, and good luck in those efforts. And thanks overall for this item.
And that concludes our request to speak.
Thank you. Then we'll call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Smidian.
Aye.
Thank you.
We'll say thank you to all who participated today. And that concludes today's meeting. Without objection and hearing none, we say thank you. The meeting is adjourned.
Thank you, everybody. And we'll meet in August.
Recording stopped.